please call them back here. Wamono Bruno Nua. And then we have Jane Gatwiris. So I don't know who is going to help us with projections. So I am going to start with Jane. Jane is going to make a presentation. By the way, before I assumed that everybody knows me. He only mentioned one name. I am Rebecca Nekaka. I am a medical doctor, a public health specialist in the Department of Community and Public Health at the Faculty of Health Sciences, Busitema University. Glad to meet all of you, and I'll be chairing this session for just 1 hour. I should be off the stage. So Jen is going to talk about linking evidence to prevention, review of lifestyle factors, and breast cancer among Kenyan women. Jen, you're welcome. You have only 10 minutes to make your presentation.
Good morning. My name is Jane Bijiwe from Jomo Kenyatta University of Agriculture and Technology. And just as our chair said, I'm presenting on linking evidence to prevention, a review of lifestyle factors and breast cancer among Kenyan women. So this is a narrative review. I hope I'm able to use good. So we are saying that breast cancer is... I do what? Eat it. Okay, so we are saying that breast cancer is a prevalent form of cancer that is contributing to a lot of mortality among women globally. So the statistics, for example, in 2022 show that we had about 670,000 women who died due to breast cancer. The diagnosis, also the new cases were high with 2.3 million. And of course, Africa bears the highest burden of the breast cancer incidents, and it's not any different with the Kenyan situation. So Kenya has adopted various policies in regard to, the prevention, the screening, and the management of cancer. So majorly we have cancer policy. Recently, they have put in place the National Cancer Screening and Early Diagnosis Guidelines. This was done recently in 2024. So what is the problem? Breast cancer remains of public health challenge in Kenya. Reading in incidence rates when compared to the other types of cancer, it is also accounting for about 11.6% of all cancer deaths in the country. Evidence shows that if nothing is actually done, it's likely that in the next 20-year period, the cancer incidences are going to increase by 70%. However, we have behavioral risk factors that can be modified so that we have a different situation, and this includes issues of diet, probably overweight, and physical activity. Yet we have a national survey was done that showed that 30% of women in Kenya, they remain either they are overweight, they are obese, and 60% of them are physically inactive. Then in regard to the diet, we have very few studies that have actually focused on women and specifically linking breast cancer to women. However, we have studies that have looked at the general population, and they have revealed about 19.3% of the Kenyan population, they are consuming alcohol. And very few are actually meeting, the servings or the recommended fruit and vegetable intake per day. The levels are so low. We have people who actually add sugar to their drinks. They are using unhealthy fats. We have 20% of the population adding salt to already cooked food, whereas we have about 4% that are actually taking processed foods. These foods are raised either with a lot of fats and salt, which is also a risk factor for breast cancer. So the other problem is that if you were to go back to the slide on the policy, they are more emphasizing on the early diagnosis, probably the screening, but there's not much emphasis on the prevention. So those factors, we just said that probably if they are modified or there are more campaigns in regard to that, we will not be having the very high incidence rate of breast cancer. So did I go backwards? What's happening? Sorry. Did I go backwards? So we did, I should have mentioned we were two of us. We did some, a review just to look at the various lifestyle factors and how they are interrelated to breast cancer risk. So we were able to look at the various databases, and of course we did data analysis, and we just picked on the studies in regard to the ones that had a quantitative approach. So when we look at physical activity and breast cancer risk, we were able to see with low levels of physical activity, then we are going to have a lot of fat deposits, and this causes adiposity that can activate, inflammatory factors. Of course, this can cause whether oxidative stress leading to tumor growth. On the other hand, physical activity is able to provide probably calorie balance, activate the immune system, and as such, statistics have shown that 25% of breast cancer occurrence can be prevented through regular physical activity. When we looked at the diets, the available literature shows, especially in regard to red meat, when it's cooked at very high temperatures, then the carcinogenic compounds are actually, produced, and this predisposes to cancer. When you look at unprocessed red meat, if you have regular intake of the same, then the risk is increased by 6%. On the other hand, when we have processed red meats, then the risk is increased by 9%. This is probably because of the higher heme iron levels. So the statistics were more or less pointing to the need to take the same in moderation. Again, the high fat diets can promote oxidative stress. And regard to carbohydrates, we had the issue of raising the glycemic index, the insulin, and then in literature it was interesting to find so many articles just isolating the soy, kind of foods and linking the same to breast cancer. We also looked at alcohol, and the indication was that with the ethanol that is present, then it has a whole cascade of, leading to breast cancer. On the other hand, there is the issue of the flesh, fruits, and vegetables that are natural antioxidants, and the same were found to be preventive of breast cancer occurrence. So in regard to obesity, of course, excessive nutrients can lead to obesity and oxidative stress. So in conclusion, it's just to show that the evidence is actually available that is linking breast cancer onset to issues of diet, physical activity, and obesity. So we cannot ignore these factors, and there is therefore the need for either education or creating more awareness on the same. And even as the policy makers, as they develop the policies, they emphasize more on the prevention rather than the management. So with that, that is the end of the presentation. I acknowledge my university. They gave us some funding on the same, and we've developed a paper that we've submitted to BMC Nutrition, so it's under review. We are waiting for the feedback. Thank you.
Thank you, Jane. You didn't tell us your background, maybe before you sit. Are you a nutritionist? Are you...
So I've done a PhD in food science and nutrition. Thank you.
Okay. Let's clap for Jane. Thank you very much for that insightful presentation. Just keep around. We shall get into the question session. I'm sure people are noting down some questions on what is in soy foods, so we can, but I think it's a very pertinent area on breast cancer. Our next presenter is supposed to be Ariokot Mary Agatha. Is she around? Okay, if she's not yet here, I am going to invite Joshua Eptai to make his presentation in 10 minutes. When you hear the bell, it's 2 minutes to go. Yeah. So as he sets up, I will introduce him. Joshua Eptai is one of the teaching staff at the Faculty of Health Sciences. He's the head of department, nursing, and I think he will say a little more if there is any more to say. Welcome, Joshua.
Thank you so much, Jane. Thank you so much. My name is Joshua Epwita. I have a nursing and midwifery background, and I work in the Department of Nursing, Busitema University. This work was led by my mentor, Professor David Mukunya, and it's on AI use in nursing and medical education. So as background, we know that AI use, especially among medical students, is very common. And it has advantages, but also it has concerns regarding the threats to the quality of training. And so we conducted this study to understand what medical and nursing educators think about using AI in medical and nursing training. We conducted a qualitative descriptive study, and it focused on faculty in Makerere University and Busitema University. And we conducted 19 in-depth interviews, and we obtained ethical approval from the BOOFS-REC, and we conducted a thematic analysis. So the population included faculty who were from the nursing background, biomedical sciences, and medical background. And their experience varied from 1 to 20 years in medical and nursing training. So we came up with 3 themes. The first theme was on uptake of AI use in medical and nursing education. And we had 3 sub-themes. One was on the use of AI among medical and nursing educators. And we observed that there was initial reluctance to use, but also that also occurred in the form of infrequent and frequent use of AI in their line of work. But also, the medical and nursing educators were aware that students were using AI, and so they modified the way they were teaching and also the way they were assessing students, so as to counteract the effect of AI use among students. And mostly the educators preferred to encourage students to use AI, especially when it comes to searching for information. But also for assessments, we had sentiments like, I can no longer give students to have take-home assignments because they will go and use AI. but also they prefer to use clinical scenarios where they assess for application of knowledge, and in that sense that they would not be, the students would not be able to get that information from AI. The other one is that they try to detect misuse of AI, especially among students, and some prefer to use plagiarism detectors. Others try to look at the work that the students presented. Some of the words that AI uses, the terminologies, are not very common among people, so it would be easier to detect students who would use AI. But also they could look at the quality of the writing, the English and the grammar, and sometimes you could tell that the students could not write like this. And so medical and nursing educators try to detect the misuse of AI among students. The other theme was in regards to the benefits that educators saw in regards to AI use in medical and nursing training. And they thought that it supported their teaching, learning, and assessment. Some of the AI tools were used to generate learning aids, for example, PowerPoints, but also it was used for setting and grading of assignments. For example, AI tools were used for marking, and in that sense, it really fastened their work. The other aspect in which we saw AI being used was in research and formal writing. Here, we saw that AI was seen to improve grammar, especially for people who are not native speakers of English. And also, it was used to help in proposal and grant writing, basically to polish up the write-up. The other aspect was in identifying articles for use. AI was used in that sense. For medical educators who had qualitative data, they preferred to use AI to transcribe their work. But also, when it came to dissemination, AI tools were used to develop infographics, which would really help in disseminating the information in a faster way. But also, medical educators observed that they use AI, especially in their writing, because the writing could be email, could be memo, or whatever sort, and AI was seen to really very instrumental in that area. So medical and nursing educators observed that AI use improved their efficiency, but also improved their performance, especially that it would save their time when it came to writing, but also it reduced their workload. The other aspect that AI was seen to really be very critical was in the sense that it was friendly and easy to understand. The information from AI was far much easier for health professionals to understand, and the same sentiment was shared even for among nursing and medical students. The last theme that we saw was in regards to concerns about AI use. The first one was the barriers that were limiting the use of AI in nursing and medical education, and there were faculty who were resistant to change, especially in relation to how AI can be used in nursing and medical education. But also we had some of the faculty had problems with using AI, and some observed that AI is being used among nursing and medical students, but it's very difficult to really maybe kind of punish those who misuse it because there were no policies in support of AI use in medical and nursing training. But also there was limited access to authentic or premium versions of AI, which really affected the quality of work that was produced from AI tools. But also they observed that AI tools had limitations, especially with regards to credibility of the information they produced, also how that information is reliable, but also there was aspect of accuracy of the information. And we know that in medical and nursing training, the accuracy of information can really mean that the patient outcome might be better or might be worse off. So there was really much emphasis on the accuracy of the information produced from AI sources. But also we saw that AI relies on information which is fed to it, and we tend to have lack of access or lack of local or contextual data, especially in our setting regarding the information being fed to AI. And that was seen to limit the AI use in medical and nursing training. But also, the faculty were really very strong on the effect that AI has on medical and nursing training. especially in regards to soft skills like critical thinking, innovation, creativity, because faculty thought that students would go to AI first instead of using their creativity to develop content. And so it was seen to affect critical thinking, acquisition of critical skills, but also was seen to promote laziness among students. And some faculty thought that what happens when we over-rely on AI? And they observed that we are already over-reliant on phones. And so if we over-rely on AI, we may not proceed in case AI tools in some extent fail. But also was seen to have effect on examination malpractice, plagiarism, but also was seen that students would rely more on AI, especially if they have mental health issues or other issues that they have. And so it was seen to reduce the student-teacher interaction. So in conclusion, we saw that there was variable use of AI from those who were using it infrequently or rarely to those who were using it regularly. But also we saw that AI was beneficial for teaching, learning, assessment, and research. But also we had challenges of resistance, access to premium versions, also lack of policies, and key concerns of accuracy, misuse, and ethical practices. So for recommendations as institutions, we need to think about developing policies which would support and regulate AI use in medical training. But also we need to have capacity on proper use and ability to detect misuse in case that happens. But also we need to have probably budget being allocated to procure authentic use, because we understand that AI use is inevitable and it's prevalent. So we want to acknowledge funding that we received in the conduct of this study, and this work has been published, and you can scan that QR code and you'll be able to access the link to the article. Thank you so much for listening.
Thank you very much, Joshua, for keeping time and for that insightful presentation. Yes, we're going to have all the presentations and then we'll have the session of questions. So please note down any questions that you have for the presenters. I want to find out if it's Billy Humphreys around. Is he ready? I would wish that you come to the front. Or Mary, if you're ready. I saw Mary around. Mary, you can come. Humphrey, please move to the front. And Wamono Bruno. Yeah, so Mary is going to present. You can use the other. Mary is going to make a presentation on prevalence of recurrent malaria episodes and associated factors among children under 5 years in Palliser General Hospital. Mary is a student at Busitema University. Over to you. You're welcome. Hope your presentation is ready.
Good morning, ladies and gentlemen. My name is Ariokot Mary Agatha, Year 3 medical student, Faculty of Health Sciences, Busitema University. I'm here to present an abstract titled Prevalence of Recurrent Malaria Episodes and Associated Factors Among Children Under 5 Years at Palliser General Hospital, Palliser District. I worked with a team of 7 other students and our supervisors, as noted on the slide. So on the background, malaria remains a significant global challenge, but especially in developing countries like Uganda. And we defined recurrent malaria episodes as having suffered from at least 2 or more malaria infections within 30 days, and with at least 1 episode being confirmed with either a malaria diagnostic test, that's a malaria RDT, or microscopy. According to UNICEF 2024, nearly every minute we lose a child under 5 years to malaria. And despite the multiple interventions that have been put in place to combat malaria, it still poses a serious threat to children under 5 years, with a percentage of about 76% of the global malaria deaths. With the African region still carrying the highest burden, accounting for about 94% of all the cases, malaria cases, and 95% of all deaths. In Palisa district, where we conducted this study, we noted that there is a paucity of data on recurrent malaria episodes. Most studies have been done on prevalence of malaria, but very few studies have been done on recurrent malaria episodes, and our study aims to answer such questions. On the problem statement, Uganda has the highest world's incidence of malaria, that's according to WHO 2023, accounting for about 478 cases per 1,000 populations. And in Uganda, malaria still remains the leading cause of severe illness and disease, especially in children under 5 years, accounting for about 40% of all outpatient visits, 25% of hospital admissions, and 14% of hospital deaths. According to District Health Information Service System 2, 2025, malaria cases at Palisa district stand at 27%. And the prevalence of malaria at Palisa General Hospital is 5%. That's according to records drawn from June 2024 to May 2025. Those high figures come as a shocker, considering the fact that government has repeatedly distributed mosquito nets, carried out indoor residual spraying, but we still have these high figures, and we wonder why, and that's why our study is here. Our study objective was to determine the prevalence of recurrent malaria episodes among children under 5 years and associated factors at Palisa General Hospital, Palisa District. We employed a hospital-based cross-sectional study at Palisa General Hospital, specifically at the outpatient department and pediatric ward. Our study population was caregivers of children under 5 years, attending care at Palisa General Hospital. We employed consecutive sampling where we approached all caregivers of children under 5 years attending care at Palisa General Hospital until we reached our desired sample size, which was 303 caregivers. We used a structured questionnaire, researcher-administered questionnaire, and our data was analyzed using Stata and results recorded as descriptive statistics. Our study found out that the prevalence of recurrent malaria was 34.3%, which is quite significant. And key factors were identified associated with this figure. Included, we had children who did not consistently sleep under insecticide-treated mosquito nets. They had higher odds of recurrence with an adjusted odds ratio of 2.87, which is quite high. Caregivers with limited knowledge on malaria prevention was another associated factor, with still an adjusted odds ratio of 2.15, which was also high. Other factors included poor housing, delayed treatment-seeking behavior, and residents in high rural transmission areas. Use of anti-malarial treatment was found to be protective. That is the chemoprophylaxis. In conclusion, recurrent malaria, especially among children under 5 years, remains a significant problem, affecting about a third of the children at Palisa General Hospital or Palisa District. The key factors were inconsistent use of mosquito nets, limited caregiver knowledge on malaria prevention and structural housing challenges. Strengthening malaria prevention, promoting consistent ITN use, improving housing could reduce this reoccurrence. Our recommendations were, first of all, we have existing strategies in place, which are the use of insecticide-treated mosquito nets, the indoor residual spraying, and chemoprophylaxis. These are already in place, but however, they've proven not to be adequate on their own, because despite all these, we still continue to have these recurrent malaria episodes. But that does not mean we turn a blind eye to what we have now. So continued sensitization on these existing strategies and active involvement of community stakeholders. If we just, as health workers, if we just sensitize the community members without involving the stakeholders, our information may not be taken seriously. So active involvement of the community. And then the game changer in this is the malaria vaccination program, which is currently in place, targeting children of about 2 years. And the malaria vaccination is a game changer because it aims at improving this partial immunity against malaria. So using malaria vaccination in combination with the existing strategies will really help to combat malaria and protect these children under 5 years. I'd like to acknowledge SEED Global Health for funding this research. The Palisa General Hospital team are very cooperative in our research. Our dear Dean for his unwavering support, the COBAS committee at large, my co-authors and supervisors, and to the audience for listening to me. Thank you very much.
Thank you, Mary. Please don't go behind. I see my presenters are going back. Please take a seat in front here so that we can ask you some questions. Yes, so let me welcome Isabelle Humphrey to take us through the next presentation. You have 10 minutes. When you hear the bell, you have 2 left. I hope, as Isabelle takes on, I hope I have the last presenter in the house, Wamono Bruno. Is he around? Wamono Bruno? Okay.
Good morning, ladies and gentlemen. Isabelle Humphrey John is my name, a medical student in year 3 at the Faculty of Health Sciences, Busitema University. I am privileged to be before you, to be presented with this opportunity to lay forward our findings about the knowledge, attitudes, and practices of using insecticide-treated mosquito nets for malaria prevention among caregivers of children under 5 in Mukuju Sub-County in Toro District, which is in the east of Uganda. I wasn't alone. I was working with a team of 7 and a supervisor. The background, we realized that a lot of research has gone into this field of malaria. But despite that research, we the incidence of malaria is still high on. Okay? So that means that there is a gap somewhere, at least. So the global figures were those 247 million cases and 619,000 deaths were reported globally as of 2021. And the sub-Saharan African region was shouldering most of the impact. And for Uganda, as of 2023, we were the third with the global malaria burden and the eighth when it came to malaria-related deaths. Now, the government and NGOs came up with strategies to try and combat and stop this increasing incidence, but we realize something is missing. So on that note, we revisited one of the ways or the mechanisms that were put in place to prevent malaria, and we looked at the insecticide-treated mosquito nets. These were rolled out. It's a non-government program. They are rolled out freely, given out to the masses. But we actually realized that having these mosquito nets didn't translate into usage. Okay? So WHO had it that the ITNs would prevent malaria transmission by 50 to 60%. But despite the 90% ownership that is within the country, we remain at 45 to 60%, and that is suboptimal use. Okay? In Mukuju sub-county, there lies a health center for, Mukuju Health Center 4, and the HMIS records showed that 27.3% of all children that were admitted were suffering from malaria. And there's 21 deaths in that past 1 year. 21 deaths that are related to malaria, that's a high number. Now, we are well aware that the government, NGOs, and the Tororo District Local Government made interventions to roll out these nets. But on a transect walk, we realized that these nets were actually repurposed for other functions. The communities were using them to protect nursery beds, were using them to fish, silverfish. They were using them as ropes to tether animals. Okay? And this wasn't the initial purpose of rolling out the nets. Now, we moved to identify the gap between ownership and usage. Owning a net does not necessarily translate into usage, the rightful usage. Okay? Our study objective was to assess the caps of using ITNs for malaria prevention among caregivers of children under 5 in Mukuju sub-county. And we conducted a community-based cross-section study, and we randomly visited 163 households that contained or that had children under 5. We used a structured or researcher-administered questionnaire that was translated into Ateso, Jap, and English, and we used this PSS to analyze our data. Now, on that analysis, we found out that 60.1% of the masses had good knowledge about the ITNs. They actually knew that these ITNs were used as a preventive measure. But despite having that high knowledge or that good knowledge, it didn't necessarily translate into usage. You can see that 30.7 only constantly use these ITNs. And that highlighted the gap between ownership and usage. We went ahead and did correlation analysis where we were comparing knowledge and attitudes and then attitudes and practices. We found out that there was a significant association between knowledge and attitudes, but it was weak. Okay? Having good knowledge did not mean that somebody had positive attitudes towards the use of these nets. And for attitudes and practices, we found a strong statistically significant association where if somebody had positive attitudes towards the use of ITNs, they were more prone to using them in prevention of malaria among their children that were under 5. Now, we also went ahead and found out that some social demographic factors were determining ITN usage. That is a respondent's occupation and their level of education was influencing ITN usage. For example, those that had a good level of education were more inclined to using these ITNs than those that were not. That was simply because of the misconceptions that were in the community. Now, we went ahead and concluded that the attitudes, the knowledge was good, but the attitudes and practices of these caregivers towards ITNs were poor. Now, we moved to address recommendations, to get recommendations that would help us address this problem. Addressing misconceptions, this was aimed at, this will aim at influencing positive attitudes over the negative attitudes. If we go with a health education message that is not only focusing on how these nets should be used, but considering or putting into consideration how the different people feel about these nets. The misconceptions out there are really many and loud. Some claim they have warmth, or when they get into these mosquito nets, there's a lot of heat. So we need to tell them that, no, if you're to weigh advantages, you'll see that the warmth over the malaria infection, the malaria infection carries a higher burden and a negative productivity. And then being culturally sensitive, this was, we could also tailor messages that are culturally inclusive, okay, and not just sitting this side and coming up with messages. All right. Okay, so thank you. I would want to acknowledge SID Global for it actually funded this research. Our dear Dean, who made sure that we attend this symposium, my colleagues that I worked with, and the COBAS team. Thank you for listening to me.
Thank you, Humphrey. You can have a seat anywhere there. So, colleagues, I think we've heard from the different presenters. Our presentations have spanned from breast cancer and risk nutrition versus breast cancer. We have talked about prevalence of recurrent malaria, AI, and we have also heard about insecticide net use. So I want to use the remaining few minutes for us to We have about 12 minutes, I assume, yeah, to the next session. So I want us to use the next minutes to get some questions, and then the presenters will respond. Feel free to put up your hand. I think someone will help me move the microphone. There's a hand behind. We'll take a round of questions, so the presenters, you listen and note what is coming to you.
Okay, thank you very much. All protocol observed. Joel Kitutu is my name. I used to teach, so I've been asking questions since the first day, and I think some people are asking me during tea break, human, can't you keep quiet? You will forgive me, I was also an academician, but I'm a humanitarian. But there is, of course, synergies. We keep learning from industry, operation, and academics. Knowledge, attitudes, and practice. Insecticide treated nets. We also give out nets, by the way, part of auxiliary work that we do with the government of Uganda. Sometimes we do massive procurement of non-food items, and we just go and give nets. But we also do operational research to see what are the gaps, what are the gaps in the programming. I only want to add on the last presenter, Humphrey, I think, just to emphasize the issue of community engagement and accountability. And the key thing which I mentioned earlier is the feedback mechanism. How do we capture feedback from people? My colleague presented about misconceptions. He was talking about Ebola yesterday. I don't know whether you heard his presentation. The issue of addressing those misconceptions, rumors, cultural ideas, and issues there within the community. How to capture them, because we recognize they exist. But there is always a gap in capturing them. How do you capture them? How do you make sense of them to improve your programming? That's something that we are learning for us from operational research. I would like to encourage the presenter maybe to pick it up and see how we formulate a feedback mechanism to improve the programming. Maybe it can inform government interventions than us just giving nets to people and they are doing wrong things with them. Thank you.
Thank you. Thank you, Kitutu. I think there are two other hands here.
Thank you. My name is Oweri Bennett. I'm an anatomist. So my concern goes to Dr. Jane. Dr. Jane, first of all, thank you for the wonderful presentation. I noted in your presentation you talked about the linkage of cooking meats under high temperature to the production of carcinogen, which you say it subsequently increases the risk of breast cancer. Now, my concern is, how do I explain high temperature to my grandmother who is using firewood and charcoal? Would you just clarify on that? Thank you.
Thank you. We have...
Yes, thank you. Hassan Kasuja. I'm a clinical microbiologist from Clark International University. I'm quite impressed to see students presenting. I think next time I should come with mine as well. It's very inspiring, and I'm happy to see them, being channeled into this. So, to Mary, thank you very much. So when you said appropriate medication as one of the drivers for recurrence of malaria, what was appropriate? What did you define as appropriate? And then two, there is last, I think 3-4 years back, we were at our regional referral here. Professor Dan was part of us, and David, who is a pharmacist. And there was an unwritten rule that all the children, all the pediatric patients, we are getting ceftriaxone as part of the management. Irrational, we would think. And why I'm asking Mary is, were there characters like this? And also, too,
after seeing cases of inappropriate medication or antimicrobial use, did you take any interventions, probably to the clinicians or to the caretakers? Again, I would understand if you didn't, because probably as medical students, you would have a limit on to how much you would do. And also, what informed 30 days as a measure for recurrency? You also mentioned that. Isavi and Martha had some contradicting statistics. One said Uganda, I think, carried the highest burden, malaria, and the other said it was ranked third from WHO. I think, I don't know if I got that wrong, or one of them had to, do much further review. I'm also quite impressed to hear that, because what we hear out there is people resist insecticide-treated nets, what Isabia said. The main driver usually was because of the insecticides, actually. They think they would have negative impact on them. But what he, I think, floated first was the temperatures. Did you hear, I'm just asking, I could have gotten that wrong. So did you hear about cases that people said they were resisting insecticide-treated nets because they would think the insecticides have an impact on their health? Thank you very much.
Thank you. Very much. One more, okay? That should be the last.
Oh, thank you. I'm also very impressed to see. I'm Martha Mudua. I'm a trial coordinator. I'm very impressed also to see students presenting, and very well done to you both. My question goes to Issa Vidya. I would really like to understand a bit more what these negative and positive attitudes were. I think that wasn't very clear from the presentation. How did you define them? And do you think from your presentation, from your findings, that a qualitative study would have answered this question a little bit better?
Noted those questions. Let me also give around a few questions. One to Joshua on the artificial intelligence use among health professional educators. And I think it is something that is is trending now, that we have to discuss the use of this. So you spoke to, I know you noted that a number of students, over 70% are actually using AI in their studies, and the educators. I was wondering if from your interaction with the educators, do they actually know that the students are using AI to this level, and what do they think about that? Maybe the other thing that I know that you mentioned that they are also using AI to modify assignments and all that. I wanted to know if they are using AI to set exams. Is it something that came through? And if they are using it, how are they doing it? And what do they think about having a summative exam being set by AI? And how do the students find such an exam? To Mary, talking about malaria and recurrence. I don't know if I missed the period that you did this study. When was it done? Is it this year? Which month? Mary, I just want to clarify the month, then I'll ask my question. August this year. So the Ministry of Health rolled out the malaria vaccination in around April this year. So meaning that by the time you're doing this study in August, the vaccination program was already on. So my interest is these children who are presenting with the current malaria episodes, did you find out if they had actually received the first dose or second dose of the vaccination, and how would that impact on the recurrence? And I think right now we have a full-blown malaria vaccination program. So probably if they take the vaccine, we shouldn't be seeing some of those challenges. Okay, so let me give the presenters opportunity to respond to those questions, and then we'll close up.
Thank you very much. Once again, my name is Ariokot Mary Agatha. I had a question about appropriate medication. By appropriate medication, I meant the ACT, the artemisinin-based combined therapy for malaria. But on top of using ACTs, some of these people were not completing doses. They were having incomplete doses. You take for one day and you don't take or you don't finish the dose. And then what I used to inform me on the 30 days, when I visited the district health offices, particularly the biostatistics department, they informed me that below 30 days, they count that as a reattendance or a reoccurrence. But beyond 30 days, it was considered a new infection. So I was interested in the reoccurrence of malaria, which was within 30 days. Then from Dr. Nekeka, had these children received the first vaccine? Some of them had, but some of them had not. I guess they were still trying to believe this vaccine actually works. But the point is to ensure that they actually take up this vaccine. And one way to find out for sure if it works is to now study, do these episodes reduce? Thank you very much.
All right, thank you. I had 3 questions. I'll start with Martha. How did the negative and positive attitudes come about? These were measured from responses from the respondents. We designed a questionnaire that had an attitude portion, an attitude part, and it was scored using the Likert scale. So these the figures that we came up with were actually measured. Would a qualitative study answer these questions? Yes, it would, because this is a bit deep. You go to the community, talk to the people, get feedback from them, and they share from live experiences. I think a qualitative study would really answer these questions. It's just that being a student, I had limited time, and I couldn't use a qualitative study. For the misconceptions from my microbiologist, we came across several, and I was just using warmth as an example of the very many, but some claimed that these nets actually suffocate them. Others, the insecticide itches when it comes in contact with the body. And of course, the general misconception with drugs with drugs coming from wherever, people know it that, keep saying that these things will affect them negatively, okay? Especially towards the fertility line, yes. And for the feedback, thank you. Thank you for the compliment. I think when we get deeper into this, we shall devise better feedback mechanisms because, well, as you noted, they inform government interventions. Thank you.
Thank you. Let's hear.
Yes, thank you so much, Chair, for the 2 questions that you've given me. The first question is that do the health professionals' educations know that students use AI? The answer is yes. the tricky part is that the students use AI more than the faculty, but also that the students are more proficient and more competent in using AI more than faculty. That means that while we are aware that students use AI, and we try to put mechanisms to really protect or safeguard against misuse, students have an upper hand in regard to using AI. And the other thing that we had was, do they use it for setting exams? The answer is yes. Do they use it fully or partially? The answer is they use it partially, and they don't rely on using AI. And we saw some sentiments that instead of using or giving students take-home assignments where they'll go and use AI, probably you can modify your assignments, maybe generate clinical scenarios on the ward, and then you ask students to respond to that assignment. So the faculty are aware that students use AI, but also the faculty have a big outcry that there is not like a support from the institution, especially in policies or systems in place to safeguard against misuse of AI. So you have individual faculty putting in measures to safeguard against misuse, but also they feel that they do not have support in case they are challenged and say this student has used AI, maybe to this percentage. They feel that they do not have a support and really a big outcry. And that's why they suggested that probably we can have a policy in place to safeguard against AI, so that students, when they use AI, they're supported, but also faculty can really say that there's been a misuse of AI. So in conclusion, I think as faculty, we really need to reflect about the use of AI among students, also amongst us, and we see how we can promote appropriate use of AI. Thank you so much, Chairperson, for the question.
Thank you very much, Joshua. Thank you, colleagues. And I think we have some take-homes. One is we need a policy. I'm starting there. We need a policy on AI, so I hope our rapporteur, you captured that. And two, we need the institution to procure for us authentic AI apps. I use AI, I pay for it. And my students, no, some are here. I catch them when they use AI because I know how AI works. So we need these things, we are not going to run away from it. But then there is what we need to train ourselves, train our staff on the responsible use, how to use the AI. There is using AI, but there is knowing how to use the AI. We shouldn't hide our heads down the table and think, oh, no, we should not use AI. These tools are here with us. We are using them, but how do we use them is very important. To the students, thank you for the presentations, and I think the questions help you when you're moving on to your maybe later research. We need to know which question can be answered quantitatively and which question can be answered qualitatively. So when you talk about the positive and the negative, remember that you are in that community, you did that work when it is somewhere online. Then also, I'm sure that you'll be learning. If there are a few comments about the slides, they were so crowded, we need them to appear better, we can learn that, there is still time. I saw a picture of a mother and a baby and the face. I hope you got consent. So if you do not get, it's important that when you take a photo of a client in the community, they consent for you to use their photo in the presentation elsewhere. But also we encourage you, if possible, you cover their faces so that they are not seen. We had a question for Dr. Jane, but unfortunately she had to run away on red meat. I don't know if there's anyone, a nutritionist, who wants to tell us about high temperatures and red meat. But what I know is that we should reduce the red meat. And what came out key from her presentation is lifestyle change. We need to, and the things that she was talking about do not only predispose us to cancer, but to all non-communicable diseases, diabetes, hypertension. So if we improve our lifestyle, feed better, do exercise, then we should be able to present all these non-communicable diseases. Otherwise, thank you, and I want to hand over to the coordinator of the session.
Thank you so much. The team that has been moderating the session, the chairperson, particularly and the rapporteur. Let's give them another round of applause. Maybe we should apply for Kisanja. I don't know. Is it acceptable? Thank you. Without wasting our precious time, I think the next chairperson of the session should be able to join us. That is Dr. Carol Kauma. Dr. Carol Kauma. Is she around? Sorry for that. We're in B session. It's actually Dr. Masaba Soedi. He's not around. Wow. Joshua, I'm kindly requesting you can chair it. Yeah, I'm requesting that you chair in this session. You can take a seat. Can I have one student rapporteur? Doc. Thank you. Thank you so much. It's all up. We're going online. So we're actually going to experiment one of the presentations online. Next presenter, the first presenter is going to be online for this session. But for those under this session, I don't know if they are available. That is Navagala Grace Sanyo, geospatial distribution of MRI, MR1, coverage of missiles, case clustering in Uganda. Are you around? You'd move closer and even come and load the PowerPoint. Then the next one, strategic marketing dimensions through celebrity. I think this one was done yesterday. Yeah, this one was done yesterday. Then faculty engagement, strengthening the internationalization agenda of research-led university through institutionalized strategies for internationalization at home. I saw her, I'm not seeing her here. That is Elizabeth Malera. Then simulating the effect of climate change on maize bean productivity in Singiro district. Wycliffe, Tumwesije, isn't there. Then impact of land use and land cover change on carbon stocks in Sereric Cover Reserve, Central Reserve Forest in Uganda. Samuel Okurut. Wow, they're not present. But of course, if they're not present, I would kindly request the students who had loaded in their PowerPoints to come forward and take the seats and present. Because time waits for no man. So we're going to have a present online, but for that, I have to give the controller of the session.
thank you so much, our moderator and the Dean for giving me this opportunity to chair this session. So we are going to have online presentation. I hope it can be projected. So as we wait, we can have the next people load their presentations here so that we can project them. Mugume Emmanuel, please come forward so that you can load your presentation. And then also we have Wamono, Noah. Make sure that your presentation is here so that it can be loaded. Sorry about that. I think we are set. The network was disturbing, so we shall have the person present online for 10 minutes. When it is 8 minutes, we shall ring the bell, and then at 10, bell will be rung. So I think you can project, and then we can listen into the presentation. Thank you.
data that we needed, a multi-stage sampling technique was used to arrive at a sample size, and a sample size of 146 respondents was interviewed for this study. And when it came to analysis, a probit regression model was used to predict which determinants influence the willingness to accept integrated pest management. And this was because the dependent variable for this objective was binary in nature, that it took on a value of 1 if a respondent or if a farmer was willing to accept, and 0 when they weren't willing. And this is to show the results that were after analysis that were what was found out. And from what we can see here, we see that land ownership type was significant and positive. And then the land size allocated to vegetable production was also significant and positive in influencing the decision to whether to accept these IPM technologies. And extension got from NGOs was also positive and significant in influencing the decision to accept the IPM technologies. And then last was the income from vegetable production that was also positive at a level of 1%. So in conclusion, it was observed, and the findings indicated that the factors that influence the decision to accept IPM technologies were land ownership and the land size that is allocated to vegetable production, the extension service, and income from vegetable production. And recommendations that were drawn from these findings one was to give IPM input so that people and farmers can be able to implement the IPM and use it in their production. And then also strengthening farmers' education and training them on IPM, because during the period of carrying out the study, majority of the farmers were doing IPM, but they were not doing it in the proper way that it's supposed to be done. So that's why this recommendation comes in. And then to also strengthen the land tenure system, as we see from the findings that land ownership was significant in influencing the decision to accept the IPM technologies. And this brings me to the end of the presentation. I would like to acknowledge my supervisors who guided me through this study, and also I would like to thank Busitema University for organizing this symposium and granting me the opportunity to present. Thank you very much for listening.
Thank you so much, Nabudu Sharon, for presenting. You have used 7 minutes. That gives us 3 minutes. I want us to take note of the questions or comments that we have for her. And I'm going to request that we take a break, and we go for breakfast, and then we shall come in to listen to other presentations. So I'm going to request the chair to lead us where we're going to go for breakfast. Thank you.
Thank you so much, sir. there is more online business coming, please. Thank you. Let's go and have breakfast first.
And here are some more pictures of the hospital, just for you to remember what it looked like back in time. And one of the problems that we had seen was that people were starting to say, no, you shouldn't breastfeed children anymore because of HIV. And if children are not breastfed, then you are in big trouble. And so we visited this antenatal care unit, and we tried to understand how are they managing children with where the mother is HIV infected. Here's one of the very early group pictures of the group of people that is a mix of people from Kampala, Makerere, and also locals here that you probably recognize, some of you. One of the doctors that we linked up with was Dr. Robert Byamugisha, and he became one of the PhD candidates on the project. We got this is the hospital from the eye clinic looking upwards. If we turn around, it is the manpower. And inside manpower, we actually walked all the way down, and we got a project office in one of the apartments in manpower at the time. So here are some pictures from the office at the time. The very first study was a study on breastfeeding in children. Here is the whole team. Some pictures from the different meetings that we had at Manpower. This is the problem that we had seen in Kampala. In Kampala, they were running, UNICEF was running a pilot trial handing out breast milk substitute or infant formula to women with HIV, and so told them not to breastfeed. And in the pediatric ward, the place flooded with children below 6 months, severely malnourished. And we felt that this is not a workable option. Therefore, we need to find an option where the children can be breastfed and still not get HIV. And then it was like a bandwagon. A lot of things were happening at the same time. If you remember 25 years ago, we talked about exclusive breastfeeding, so and so. But very quickly, we also came over to drugs, saying that the mother should take drugs and the baby should have PrEP. Today, we all know about PrEP. At the time, this was a very rare thing to talk about. So we set up a study, and this is actually, if you recognize the building, it is where the dean is sitting today, the the Dean's office behind the eye clinic. We had that as a clinic for our next trial, where we gave active prep to the infants during breastfeeding. And we did this in a consortium. We linked up with other people in Africa, from South Africa, Zambia, Uganda here, and Burkina Faso. And we had partners in Europe, from France and Norway. And we called this consortium the PROMISE Consortium. And it is actually like a transect through Africa. So we have West Africa, East Africa, Central Africa, Southern Africa. So we had one research hub in each of these places. And the first publication was published in The Lancet in 2011. So I think that is like a quality mark for our study. And we called this one PROMISE EBF, EBF for exclusive breastfeeding, because that was the first study about. A couple of years later came this study on PrEP for infants during breastfeeding. Here we compared two drugs, lopinavir/ritonavir versus lamivudine. So nobody got nothing. Everybody got something, but two different drugs. And that was also published in The Lancet, as you can see. We have continued with other publications along the same lines, but in the next one, we didn't get enough funding to get all 4 countries on board, and that study was conducted only in Burkina and Zambia, etc. But here we focused on survival of the infants, and we organized another project with increasing capacity for mama-baby survival in post-conflict Uganda and in South Sudan. So here we linked up with Busitema, first of all, but also Lira, Gulu, and Juba. And we had PhD candidates from all of these sites. Yeah, we can look at the different sites. Makerere was also part of the team. Yeah, typically what we did was that we used these empty containers as research clinics. So this is actually from Mokono. You can see it from the road if you pass. In Lira, we now did a very large community-based study where we actually weighed all the babies after birth, even if they were born at home. The idea was to, in northern Uganda, many people had lost the habit of going to the clinic during all the difficult years. They were doing everything at home, and few mothers came to clinic. So the idea was to encourage them, prepare them in the intervention arm to see if we could increase the number of mothers that gave birth at the clinics. And that worked very well. Here is also the whole group. We actually had a very large group with data collectors in this study. An example of the data collection that is being done. And Agnes Napio was one of the PhD candidates. She actually studied the care in the HIV clinic in Lira. Yeah, more pictures. Now we are back in Mbale. This is the view from the mountain. I'm not sure you can recognize where it's taken, but still, I think over the years, the Mbale has increased in size, and a lot of construction is ongoing. And one of the very tangible improvements have been the establishment of Busitema University here on site. I mean, Busitema existed before, but the Faculty of Medicine or Health Sciences was established, if I remember correct, 2008, and started medical training at that time. So now we are collaborating very closely with Busitema University and we actually have several grants, and one of them David is going to talk about later today, so I'm not going to disclose much about that one. Yeah, this is the house where the administration is housed, but that is also where we had our clinic back in the days. And here is our VC demonstrating the new premises, the library. Yeah, the new buildings coming up. Here is Mikri, that we have also collaborated a lot with. And this is the most recent study, the one called Baby Gel, that was done in conjunction with Liverpool University, Bergen University, and here. And it was also a very large community-based study on the use of alcohol-based hand rub. And here is Peter Olepot together with one of the PhD candidates, Martin Chibet, and Andrew Weeks, who was the PI for the Baby Gel trial. And on this project, we now have 3 PhD candidates. It is Noella. She will defend in November. Martin, he will defend in January. And Francis is about to submit. Yeah, there are some pictures of them presenting, and here we are discussing. So these are the PhD candidates from Uganda that I have supervised. Not all of them have been I have been as main supervisor, but I think that is what David was alluding to. And today we have one study ongoing, and I will not tell you more about that, but we also last month got a new grant for more research collaboration and PhD training together with Bergen, Makerere, and Busitema University. So we are still in business for a number of years ahead. Thank you very much.
Thank you very much, our distinguished professor. I think he deserves another hand clap. You can have a seat, Prof. At this moment, we have been joined by our Honorable Minister online. I will have this honor to invite the Dean, who will invite the DVC, who is also online, in that order, to invite the Minister to speak to us. Thank you very much.
Innovation. On day one, she's really part and parcel of what we want to do here at Busitema, to use science, technology, and innovation to advance or contribute to our country's national development plan. At this point, let me now welcome my boss, Professor Pakoyo Kamba, who is the Deputy Vice Chancellor in charge of Finance and Administration, to welcome our dear Minister. Let's give a hand of applause.
Thank you, Dean. Thank you, Dean. Our guest of honor and the keynote speaker who has just shared a lot of wonderful things with us. All keynote speakers, the organizers of the third Busitema University STI Symposium, all participants, ladies and gentlemen, protocol observed. Good morning. I have about two simple duties. The first one is to congratulate all stakeholders in this third symposium for a job well done. Moment to welcome the Honorable Minister, who is a very good friend of Busitema University, and to invite her to speak to the symposium, Pursuing Excellence for God and My Country. I remain Professor Pakoyo Kamba, the Deputy Vice Chancellor of Finance and Administration, Busitema University. Member, we are out of silence. I hope you heard my remarks.
Yes, we did, Professor.
All right, thank you.
Yes, sir, Professor, we listened to you attentively. Thank you.
I request that Mr. Cosmas Mwikerize can give the meeting updates. The minister should be joining any time now, but Cosmas has been on the call for minister, so he should give the updates as soon as we are ready to proceed. Thank you.
Yes, as we wait for the connection with the minister from Dr. Cosmas, I've learned that there are some people who have some questions or would want to hear more from the keynote speaker. So at this time, in case you have some inquiry or a question, we can use this time at the moment. We have the microphone.
Well, thank you so much. I am a young pediatrician, so I'm interested. How did you join the PhD program? Also, on your research, when you're doing the riponavir, ritonavir, and ramivudine, did you get some resistances, and how did you go about it? And then the ethical considerations by then, how did you also go about that? But thank you for the good work done, and I hope you can supervise me too.
Thank you very much. Resistance appears in people that are infected. But if you take antiretroviral drugs to protect you from infection, there is no virus that can develop resistance in the body. So for prophylaxis, resistance isn't really an issue, unless the baby is getting infected in spite of the prophylaxis. Then you will need to treatment, and then that's a different story. Ethically, because everybody got prophylaxis, there wasn't really an ethical problem. I mean, they could choose to join the study. That was of free will. But if they joined, they knew they would get a drug. They didn't know which one. But I think the ethics committee was agreeable with us that both of them would actually. What we learned is that ritonavir is actually has more side effects than lamivudine. So if you are not infected, you could as well go with lamivudine. I think that is the short story. At our university, we are taking on PhD candidates with that as part of project. So this Survival Plus project, we got funding for a package of things that we had planned together, and we had in total 8 PhD candidates in that project. So that is the way to go about it. So we don't have singular stipends, scholarships that we are handing out here and there. So it has to be in the context of a project.
Thank you, Professor. Dr. Alfonsina is from our university, Kingston University, and she just completed her MA in pediatrics, part of our staff development program. But my question is a follow-up on that one as well, about how we key in as a young university. What brought us here is exactly this, to deliberately collaborate, find partnerships. And I've seen like most of your work has been with Makere and Busitema and the long-established institutions. But as a young university, we are deliberate about what we can do with the already established, all those who have already moved the mile. And like you've said, like that program which you've already worked out with the partners, maybe it's high time. How do we key in and we get partners like you, and maybe we work on such programs where some of our own, very own, can benefit? Thank you.
Yeah, in the previous project, we said we are going to have 2 PhDs from Juba, 2 from Gulu, 2 from Busitema, 2 from Makerere. So it was evenly distributed in the end. Now, you could say that Busitema gained an extra point by David Mukunya moving here, because he was on the project on the Makerere side, and then he moved here. So you got some bonus on top of what was scheduled. Yeah, collaboration. I think that it is a good idea to collaborate both with old universities like Makerere and the young ones, because there can be a lot of transfer of knowledge from the old ones to the new ones. And for instance, courses, etc., may exist already in the older university that could be, yeah, the younger universities could benefit from this.
Thank you, Professor. My name is Kennedy Chimba, Department of Pharmacology at Busitema University. I appreciate you for the extensive work you've done, interesting work you've done in Uganda, and I appreciate you for taking us back in time with the pictures that you presented, you showed us. I noted with concern that actually, when you look at the infrastructures, the buildings, the roads, nothing much has changed. It's as if we are still in 2003. Besides the people changing, the buildings and the roads, infrastructure is still the same. So I'm wondering, in regard to Uganda's health policy on nutrition, what has changed when you compare 2003 to 2025? That is number one. Number two, 2 decades ago, I noted from your presentation that I think famine and acute food insecurity were the major drivers of malnutrition. Now today, what are the emerging drivers of malnutrition in Uganda, and how should clinical practice prepare for such? And lastly, having dedicated over 2 decades in Uganda to research on malnutrition, what has been the most disheartening or disappointing trend you've witnessed in Uganda? And conversely, what development gives you hope, the most hope for the future of Uganda's children in regard to nutrition? Thank you.
Thank you very much. We shall only have those answered, and we shall go back to the online platform.
Okay, briefly then. Disheartening, it is disheartening to meet mothers with malnourished children in clinics, and sometimes the mothers are very young, very unexperienced, and not really able to carry the load that they have been given. And at times that is disheartening. In terms of clinical management, the big difference somewhere along the line has been that UNICEF stepped in and provided the feeds that are needed, the F100 and F75 that is commonly used in the malnutrition units. That has made a big difference in terms of management. And the next big breakthrough was the ready-to-use therapeutic food. It's looks like peanut butter. It's a bag that you can slide open. You don't need to have it cold. You can give the bags to the family and they can go home and they don't run the risk of being getting infections from their neighbors in the clinic. So there has been two very big important breakthroughs in the management of malnourished children. And then, of course, you may say that there is still some needs for better diet for the kids. And one of the problems is ignorance. The tummy of the child is very small. So it's very difficult for a child to eat once a day or twice a day only. The child needs to eat often in order to grow well. And this is not well understood everywhere. I think that is one of the big tumbling stones. I think we should move on to...
Let's clap for our keynote. Thank you so much, Prof, for that session. Again, I'm going to welcome the DVC, now that the Minister is online. ICT, let's confirm. Yes. DVC, yes. If you are able to hear us, kindly welcome the Minister to speak to us.
All right. Thank you, Symposium Chair. Our guest of honor, the Honorable Minister of Science, Technology and Innovation, Honorable Dr. Monica Musenero. On behalf of STEMA University, our Vice Chancellor, who is actually with us online, and the entire symposium community, we warmly welcome you to STEMA University, and it is my singular honor to invite you to speak to us. I'd already given some few remarks earlier, but they really centered on congratulating the symposium organizers and thanking all the symposium participants, and most especially those from outside of STEMA University and outside of Uganda. At an appropriate point, I think the organizers will furnish you with a report, but we have been informed that we have had representatives, I think, from over 8 countries, maybe even over 10, and we don't take that for granted. Finally, Honorable Minister, you know that with STEMA University's TI is because of you. We will not get tired of thanking you and wishing you the best ahead. I now invite you and yield the floor to speak to the symposium participants. Pursuing excellence for God and my country. Thank you. I'm Professor Pakoyo Kamba, the Deputy Vice Chancellor for Finance and Administration of STEMA University.
Thank you very much, Professor Kamba. I hope you can hear me well.
Yes, we can.
Yes, we do, Honorable.
Okay. Thank you very much for welcoming me. The Vice Chancellor of Busitema University, the members of the Council, the Senate, our distinguished researchers and innovators, the representatives from industry, government, and civil society, our international guests. I've heard that we have representation from many countries. Been informed we have some from Kenya, Tanzania, we have some from Ivory Coast, USA, Norway, Pakistan, and many of the other countries that are represented here. I wish to welcome you to Uganda, our international guests, and welcome all participants to this symposium. Let me begin by apologizing for not being there physically with you. Our science, technology, and innovation, and therefore we really appreciate the institutions that take lead in making sure that scientists meet, they share, and they are able to deliberate and discuss. And over the past few days, we have witnessed knowledge when guided by purpose and connected to production. It becomes a very, very powerful driver of change. The government of Uganda has recognized very powerfully that science, technology, and innovation, or what we fondly referred to here as STI, it really forms the foundation of the journey of socioeconomic transformation of any nation. And because of that, we are moving very, very deliberately, very intentionally from emphasizing the whole spectrum of science until it impacts on our economy. When I joined here, there was a discussion on malnutrition, and it's very disheartening that we should be talking about that kind of malnutrition now in our country. Yet we have knowledge, so we need to convert that knowledge to turn into solutions and tools that are readily available. Because in a nation like Uganda, there is really no need for us to have malnutrition. Our health care. Now you can ask, how do you industrialize our health care? For example, I heard we were talking, I think, about PlumpNut, UNICEF coming in, and those products should be readily available within the country at every clinic. We don't really have to wait for UNICEF to come and give us those products because they can be cheaply manufactured here. The challenge is that because we did not industrialize our science, the professors attending this symposium, all the scientists. So the season that we are in, as you know, is for us to harness the power of science to build a knowledge economy. And so, as we have discussed through this symposium, and we have deliberated many of the issues, bringing knowledge from across the nations, across institutions, is for the purpose of us and we begin to impact on the way our people live, on the way our people do their work, on the technologies that they have access to. The institution I lead, which is the STI Secretariat at the Office of the President, we are working very, very hard to make sure that we strengthen linkages that allow the richness of knowledge. Our institutions really in Uganda and indeed in Africa and across this continent, there is a lot of knowledge. But in the past, we have left this knowledge in the classroom. Both knowledge communicated right across throughout the education system has tended to exist side by side with the ignorance that we are studying in primary school, but the child does not go home and connect that to their health at home. And that can progress up to university, where we are doing research in the universities, but it is not showing up in our pharmacies. It's not showing up in terms of the products that we have. This is the major drive, dear participants, that we in Uganda have agreed, and the Busitema University is a key stakeholder, that knowledge must result into development of tools that guide us, and the tools that we need, and those tools must turn into innovations to be scaled and applicable to solving problems, and we must move those into industry. These innovations should be manufactured to help us address issues that are happening in our community, that are happening in our society, that is happening in our labor systems, so that we are able to progress economically, even as we progress in all other aspects of life. Universities such as Busitema are the heart of transformation. And this university specifically, I wish to congratulate really the Vice Chancellor, the Council, the Senate, the staff, the scientists at this university have become frontliners in this agenda, in transforming our education to impact on our economy. They have moved away from just teaching to becoming centers of excellency that produce technologies. As they generate knowledge, right from first principles across to industrial production and to community consumption, we see that there is an impact that is beginning to show up. And the linkage with the multiple universities across Uganda and across the continent makes this a very, very rich repertoire. The theme of this symposium, transformative education, climate smart agriculture, One Health, entrepreneurship, clean energy, and STEM, reflect precisely the direction that we are taking as a country. And I must say I was very, very pleased to see this theme coming at this point, and each of these domains really speak of where we are in our frontiers and the roles that we are playing. So I want to thank you for taking the bull by the horns and moving really on this transformation agenda. I've been impressed by the outstanding presentations in this week, about which I've been briefed, including the banana textile industrial value chain. Banana is a very, very favorite plant in Uganda. Unfortunately, when I was studying agriculture at O level, there was no content. And throughout the education, I was told that banana is just water. And it's not really a good food. It was a source of malnutrition. But the way we have grabbed now this knowledge has turned around this plant, which is an icon for our nation. Sometimes Uganda is referred to as the Banana Republic. And we are now not only looking at the bunch, the banana bunch, which is the main food, the staple food, which we have also added on value to the banana textile industrial value chain, not just a small component of it. And we are transforming waste into wigs for hair, clothes, biochar, fertilizer. And this is really what knowledge does. This is what we call value addition. The knowledge economy looks at the raw material and pulls value from what was waste. The other one about optimization of natural therapeutics for plant and animal health, demonstrating how indigenous knowledge can power a global bioeconomy. And of course, Busitema, you have been our pioneers in championing natural therapeutics to the point of having one of the products completing the clinical trial. And I believe that this is going to change the way the university approaches everything, because now you need to take it into industry. And that completes the value chain of the knowledge economy, which started as science at the beginning and has gone through. The integration of artificial intelligence into service delivery, like health, agriculture, education, and also into manufacturing, really is a very, very good step for us, for Ugandan researchers. And we are looking forward to incubating many of these initiatives so that they can turn into industries. Ladies and gentlemen, until we can take those scientific concepts and projects and everything that the prototypes, until we can industrialize them, we are not going to have them impact our economy. There is, of course, the core knowledge, and then there is the supporting knowledge. But all of it is going to make sense when we are committed to taking it. So these examples, for me, prove that the solutions to our challenges already exist among us. What we must now do is scale, support, and sustain. Vice Chancellor and the staff who are there, when I visited Busitema for the first time, I found so many prototypes, and it fueled my quest for making sure that the road ahead is clear for our scientists. So as government, we are committed to creating an enabling environment for innovation to thrive. Through our National Research and Innovation Program, we have already 120 billion Uganda shillings since 2021 in 113 universities and are led by young scientists like you. We have established specialized facilities, and we are continuing to establish many. We have the Deep Tech Center at NAVE for electronics and artificial intelligence development. For many of those initiatives and the prototypes that are health tech, agro-tech, that is your home, because many young researchers, after finishing the university, they don't know what to do with what they have created. I'm glad to announce to you that there are these incubation centers. You don't need to forget your research project. You don't need to forget what you have been working on. We have provided continuity. In terms of those who are doing engineering, more hardware engineering, we have the Engineering Development and Innovation Center in Rebitete to help you refine and incubate your innovation, filling gaps in hands-on skills that you may not have had, and also impart upon you the business skills to grow your innovation into a business, into a venture, or into take it to a level where it can be acquired by somebody else. So we have finished, we pack those things and go and look for a job. You can now transform your innovation, your product, your prototype into an industry with support of government. We are also putting up the pathogen economy park in Nakasongola for vaccines, for biologics, and all the other biologics in that area, which is also going to provide a very good incubation space for you and your innovations. We are also working together with the Busitema. We shall be, this year we are going to make a good progress with the Busitema University to have the agro-science park, which will provide incubation space. So all these are platforms designed to help our scientists translate research into enterprise. We have established capacity for world-class manufacturing of pharmaceuticals, pharmaceutical production in this country. You not lack accredited facilities where to manufacture your product. You don't have to struggle to put up one before you can get your product to the market. We have also established capacity for value addition. And the number of crops have moved ahead. I talked about banana, both the banana bunch, the fruit. We also have some facilities for you if you have another banana component. We have established facilities for coffee and a number of other coffee, sweet potatoes, and a number of other products that you can now create marketable value from your scientific ideas. We invite Busitema University and our partners, as you already know, to make sure that we plug into this national ecosystem, to make sure that we are not stalled because we think that we don't yet have facilities. We have a national network of laboratories, a national network of experts, so that we can co-develop these products, we can jointly commercialize. We are bringing in experts to support with the incubation because it has been identified as an area of weakness. This symposium has gathered the participants from 6 countries, from across sectors. We have researchers, we have industry, we have policy actors, civil society, entrepreneurs, and students, basically the whole of society. And I don't see anything that makes me more fulfilled than this. Because when I started touching science, technology, and innovation as a minister, it was confined. It was really confined to very small spaces, because even the scope was very narrow. And over the past few years, we have taken science from the laboratory to society. This diversity of participation is what we need. And I want to really emphasize to the participants coming out of industry. Industry has been isolated from academia. We want stronger linkages, because industry is in the continuity of science in order for it to affect our economy. The policymakers who are here, some of you may have, some of you may not have closely interacted with the new STI ecosystem in the country, and especially in the strategic direction, the strategic actions that we need from you. You are part and parcel of the ecosystem. So I'm glad to see you here, and I want to invite you to have a closer, very, very closer cooperation and working together in the different areas that we need. The entrepreneurs, and then of course our arsenal students. Students are a huge workforce for national development, but we have been confining them to only learning. We would like to, through these initiatives, to unleash the students to contribute as they learn. And so this diversity is really, really pleasing and exciting. I know that science is now growing the necessary networks that we need, and we shall be sharing more and more. As you are an entrepreneur, don't leave that place without seeing a business opportunity. The policymakers, let us not focus. Sometimes as policymakers, we are looking more at protection than enhancement. Look at NEMA there, look at how do you enhance? How do you enhance this ecosystem so that it is accelerated? As I come to the conclusion, I want to thank the university for fostering this spirit of partnership and working really hand in hand with the STI Secretariat as we move to get regional centers. These kind of networks are the ones that we need, that will drive, but also building a complete ecosystem of what we have called the STI economy highway. Because as you are aware, government has positioned science, technology, and innovation to be a key driver in our national development, especially in the National Development Plan 4, which we have now lodged on, which we are in the second year. We are planning for the second year, we're implementing the first year. So as we close this symposium, I wish to leave you with 3 calls to action. 1, to our universities, continue to embed innovation and entrepreneurship at the core of every discipline. Let every graduate be a potential job creator, not a job seeker. 2, to our researchers, as we pursue knowledge, let us pursue that knowledge that solves problems, local problems. Many times, because research is funded by our partners outside, it tends to be abstract to our environment, our ecosystem, such that there is a huge gap between the researcher, what you come out with, and what is going to be applied. And I wish to challenge you to really focus, identify problems that we are facing and make research relevant. And to our partners, we appreciate you so much for partnering with us, our local and international partners. We invite you to join us in this exciting journey that Uganda has started. We are open for collaboration, for investment, for knowledge exchange in science, technology, and innovation. Allow me to congratulate the organizers once more and the participants for the success of this third STI symposium. You have demonstrated that science, when given space and purpose, it can indeed transform our society. And I wish to encourage us to continue to work together, to continue to work jointly. I want especially to speak to our international partners who have come. We would like to consolidate. We know that you have initiatives in your countries. We have initiatives here in Uganda. But sometimes, especially as we go downstream of science, to bring it into solutions, it is fragmented. We would like to sorry, technology disconnected me as I was concluding. Do you hear me again?
Honorable Minister.
Yes, I'm sorry that I don't know what happened, maybe internet. But I was calling upon our international partners. Africa should be viewed as one country. And we begin to hold hands. We begin to share facilities. We begin to share knowledge as we move downstream. The value chain of knowledge, the value chain of science. Science is beneficial to a nation's economy if it addresses the challenges of the economy to that nation. But we may not be able to do alone. We pray that you will be strong as we say farewell to our leader who passed on. Thank you very much. I'm glad I've been able at least to address you. I've been feeling the missing, that loss of not being part of this conference. Thank you very much. I wish you safe travels as you go. I know you'll continue with the other discussions, but I want to declare the closure ahead of time as you finish the discussions. God bless you. Thank you very much for God and my country.
Yeah, thank you so much, Honorable Minister, for those encouraging words. And now it's my single honor to invite the Directorate of Graduate Studies, Research and Innovations, to move a vote of thanks to the Honorable Minister.
Honorable Minister, on behalf of Busitema University and the host of researchers that have gathered here today from different countries, from different universities, we are immensely indebted to you for giving us the opportunity and gracing this occasion. We as Busitema University and the researchers here don't take this for granted, and we think the advice you continuously give us will make us a developed nation, given that the NRM right now is focusing on ensuring us leaping into the higher income status. As a Busitema University, we are glad and we are happy that you have supported us throughout our research and development. The various projects you have supported at Busitema University, the pathogen economy, infrastructure, space science, education, and also health, they have made the university to be a leading pursuing excellence. We believe that we'll continue to pursue excellence, and all the researchers here who have gathered here today, they're going to take away that lesson, that pursuing excellence. And as we meet next year still, since you have closed in advance, we hope that next year we'll be somewhere in one of our campuses, and we hope maybe we'll be in Soroti or Apai, but we will continue to pursue excellence. God bless you, and thank you.
Yeah, thank you so much, Director, for the words of appreciation. And now, colleagues, we are going to another session now. We have one more presentation online, and this will be given by John. So, John, I hope you are listening to us. So after the online presentation, we will again break into the breakout sessions where the other group will be down and the group that was here will be here.
Good afternoon, everyone logged in. Unfortunately, I cannot share my slides because someone is still sharing. If you can stop sharing, I'll be able to share my slides. Okay, I've now been able to share my slides, and I hope we can all see the slides.
Sorry, your slides are off.
Kindly confirm that you can see the slides.
Yes, they are now visible. Would you like to put it on PowerPoint? Slideshow mode, please.
Yes, it's in a presentation mode. Good afternoon, everyone that's attending the third Busitema University Science and Technology and Innovation Symposium. Thank you for according Uganda Red Cross yet another moment to present one of our abstracts that we submitted. My name is Joan Kataike Okello. I handle resource mobilization and partnerships at Uganda Red Cross. So I'll go straight into the presentation so that we save on time. I'll turn on my video a little bit so you know who you are talking to. So this is Joan Kataike Okello. Today, our presentation focuses majorly on a unique technological addition that we have created to accelerate the uptake of first aid trainings in Uganda. And you may ask me why. So this is what the presentation is about. I'll take a short time so that you're able to share your questions that you may have. So the application we are presenting to you today is called the First Aid Blended Learning Application. I know by the end of this presentation, many of you will have downloaded it and you'll be able to interface with it because the initial downloads do not really cost money. So I hope the slides are moving. Hello, are you able to see the slides moving?
Yeah, we can see your slides.
Okay, so just to give you a preamble about who Uganda Red Cross is, we are a humanitarian organization. We are not an NGO. We are formed by an act of parliament. So all the work that we do is done through a mandate we have to play an auxiliary role or a support role to government. We have a branch network of 51 branches. Where the symposium is, we have a branch that is the Mbale branch. So we have 51 of them located across the country. We have 500,000 volunteers and members. The people you always see at the forefront in red jackets, those are volunteers and members. We do all this in an impartial manner, so we do not discriminate. We do not discriminate against race, height, color. We respond to everyone. So today, because of the abstract we submitted, I would like to focus more on first aid and ambulance services, what we do and what sort of partnership we are seeking from you. So Red Cross, we run what we call the first aid and ambulance services. Now, on the very first one I'm presenting to the left is what we call the community first aid trainings, where we go to the communities, we do first aid for first responders, basically empowering communities to be able to respond whenever there is an emergency. Now, the second one is commercial. It's commercial first aid trainings. I'll take you through what it covers. And why we do this is we are able to raise resources to be able to respond during emergencies. Now, we also have emergency response ambulances, the ones that you see located on major highways. And then lastly, we have commercial ambulances. I don't want to take a lot of time here because I'm going to go through all of them a little more. Now, when we come to the community first aid and ambulance services, we have received support from government of Uganda, and we've now procured 21 ambulances. This is something we've been running since 2019. Now, I think at the symposium, you said this number. It's a toll-free number, 0800-211-088. If you ever see a road traffic accident anywhere on the road, you simply call that number and we shall send an ambulance at no cost to respond. So that is what this facility does. These ambulances are located on major highways, Kampala, Masaka, Mbarara, Jinja Highway, Fort Portal, Hoima, and all those highways. Now, these are the teams in response. You can see a lot of these people are road traffic accident victims. Now, what is the impact that this has had so far? Of course, we have the impact on the road traffic injuries. We have response during emergencies of COVID-19, Ebola, the Mpox, and of course, we also go on ground within the community to conduct first aid training. So you can see at the total that the numbers keep growing every year. I will not dwell so much on that because we are here to present to you more about first aid trainings. Now, why is first aid training important? I know a lot of the people in the room there and online are already converted. You appreciate the importance of first aid, but I just wanted to elaborate on it a little more. So we have a mandate given to us by the International Federation of Red Cross and Red Crescent Movement. We have a Global First Aid Reference Center. Now, this Global First Aid Reference Center enables us to have the latest curriculums for first aid. So we believe that first aid should be accessible to all, to everyone, everywhere, without discrimination. So first aid, of course, saves lives. It ensures that people are able to respond in real time within communities. And of course, we appreciate and we know that most of the people that offer first aid are usually the bypassers, the people that are within the community where we live. We don't wait for people to come from a trading center to come to the village. We always know that the people within the area, the locality where everyone lives, are the actual responders. So we also align with the International Labour Organization. There is what you call the occupational safety and health guidelines. So our trainings align to this. We ensure that the first aid trainings we do are able to reduce the severity of injuries. We equip individuals with the ability to be able to respond during emergencies and, of course, handle minor injuries. And most importantly, be able to respond when there are incidents of accidents at workplaces, at home, in schools, and within communities. As well, we are aligned to what we call the Occupational Safety and Health Act by the Ministry of Gender, Labour and Social Development. So this is all about ensuring that employees and workers are safe at a workplace, ensuring that they have the first aid boxes installed. So these are all the things that we run with. So we are also accelerating already existing government initiatives around first aid. So our role is simply to boost what is happening. Now, we have set up a first aid training school. Now, under the first aid training school, we train companies, organizations, we train individuals and families. We also train schools and students. Now, across all our 51 branches, we are able to actually conduct these trainings. So this gives you the list of the various trainings we do. I'll pick on a few: first aid at the workplace, CPR, being able to handle an automated external defibrillator, fire safety trainings, occupational safety and health trainings. Now, all these cut across companies, individuals, families, schools, and the students there. So this is just a sample of some of the first aid trainings that we've conducted. You can see these are companies, some are at our first aid training school, some are at branches. So this is just to show you the first aid trainings. Now, all our first aid trainings are actually skills-based. They are 80% skills-based and 20% theory. Now, this is the new baby on the block, and the reason why we are here today, the first aid blended learning application or tool. We launched this one in August of this year. It's about 2 months old. And why did we launch it? We launched it to fit within that busy schedule of someone that cannot come to class for 2 days or 5 days, but would like to learn about first aid. So this, we've done it together with the Belgian Red Cross. Now, this is a build on to the first aid training school that I've already presented earlier. So this again accelerates access of first aid trainings to more people. Now, how is it conducted? We give you a self-paced study, 6-hour online at no cost. So you download the app. Those are the QR codes I'm sharing there. If you can scan them, you should be able to download the app instantly right now. You can partake of the 6-hour self-paced online study at no cost. But this is also blended with a physical class. So I'm getting to that now. So in Uganda, we have approximately 14.2 million Ugandans. And these 14.2 million Ugandans are using smart devices to be able to explore a lot of information. So we want to tap into this audience to be able to accelerate first aid trainings to Ugandans. So if we can have 14.2 Ugandans download this app, they are equipping themselves with first aid tips, but also for those that want to come for the physical class, they are able to book and come for it. So we are encouraging you to sign up for this first aid blended learning app today. Become a first aid giver and save more lives. Now, how do you access it? Now, this first aid blended learning, so wherever you're seeing FABO, that stands for first aid blended learning. It's a blend of online and a physical class. So the first aid training is open to individuals, families, schools, companies, and basically everyone. Now, downloading the app is at no cost. Undertaking the self-paced study of 6 hours is also at no cost. We encourage all the medical students, medical schools, technology teams, everyone in this room, kindly download this app and give yourself first aid tips at no cost. Now, for those that would like to come in for the skills training, the physical class, you book a physical class and it costs 150,000 per individual. However, if you are a group, for example, students, we are giving them a very huge discount that we can discuss as many students book. Outside of the symposium, we have a team that has gadgets that can support you to even download this app in case you're interested today. So these are the links of how you can download this app. It is free. Taking part in the admission test is free. Learning all the first aid tips on that app is free. I'm encouraging all of you to download it and give yourself first aid tips. You can also download these QR codes on our website, which is redcrossug.org, or you can just enter Uganda Red Cross Society you should be able to access these links. But also the team on ground has them. You should be able to still download the app. In case you can't access these links, just go to your Google Play or App Store and enter the word First Aid in Africa. You're going to see across, that is the app. Download it and you'll be able to get yourself first aid tips. We have engaged numerous universities since we launched 2 months ago. We've been at Makerere University, the MOOBS, Chambogo University, Gulu University, Lira, Mountains of the Moon. We are really trying to traverse as many universities as possible. If you're there and you would like us to come to your university and engage your students about this app, why it's important to learn about first aid, please write to us. The team is out there. You should be able to get contacts. Write to us and we'll be able to respond and come and do a free demo with your students. We've also recently signed a memorandum of understanding with the Ministry of Education and Sports. This was also last month. Now, this is also challenging us as Red Cross to accelerate first aid trainings and constitution of teams of first aiders within schools. You may note that for a community of 50 people, there must be a first aider. For example, the room where the symposium is taking place, there should be a first aider. If you're more than 100, there should be 2 first aiders. So this is what we are trying to encourage, that if someone, for example, gets a cardiac arrest, someone collapses, someone is choking, within the audience where you are, there is already someone that can respond immediately as the ambulance is called to respond. Why do we need more universities and tertiary institutions to consider the first aid blended learning app? 1, first aid saves lives. 2, the first aid should be accessible to all. That's why we've made access to the information on the app free. We also are strengthening emergency response within communities. We want to empower resilient communities as much as possible. We also encourage that for every group of 50 people, whether it's a school, whether it's an office, whether it's a company, we encourage that amongst the 50 people, there should be 1 first aid responder for safety and for community resilience. We also are encouraging you to onboard, because you can self-teach yourself for 6 hours at no cost. Then as well, when you need the hands-on training within the physical class, you simply send, when you finish the training at the end, it will ask you to book a session. So once you book the session, then we'll be able to guide you on the next steps. Why choose Uganda Red Cross? We are mandated by a Red Cross Act, so you are dealing with a credible institution. We are part of an international movement, the International Federation of the Red Cross and Red Crescent. We have 51 branches, so you can reach us anywhere countrywide. We have 500,000 volunteers and members ready to support you anywhere. Amongst you, you have over 5 to 6 volunteers around you. And we have extensive experience in first aid and ambulance services. So for us, onboarding you on this app, which we are calling the First Aider Blended Learning app, is to empower more communities within Uganda to get onto learning and understanding first aid. Because first aid is not only for the medics, first aid is not only for the nurses, first aid should be known by everyone. If we can instill this within the children when they are young, within schools, within our workplaces, we shall have a better empowered workplace, we shall have a better empowered schools, we shall have better empowered communities. So that is it from us as Red Cross. Thank you so much for this opportunity, and I would like to take some questions. Thank you.
Yeah. Thank you, John, for that presentation. I hope I am reliably informed that there is one additional presentation online. This is all the way from Cameroon, from Ivory Coast. Okay. Do we already have the presenter online? The presenter from Ivory Coast? Presenter from Ivory Coast. Unfortunately, I do not see him online.
Yeah, thank you very much. As the presenter who is online is preparing, is going to present in the group which is going to remain here. We need to catch up with time. I know some people have to travel. So I want us to go to our 2 sessions. One session remains here, another group goes there, so that we catch up with time. So the chairperson of the session which is going to be here is none other than the Dean Faculty of Engineering, and that is Engineer Dr. Dumba Rwanyaga. Take the seat here. Then the session which is going to be in the reception hall is going to be chaired by Dr. Sowedi Masaba, the Dean of Faculty of Natural Resources and Environment. So I want us to request that if, in case you don't know where you belong, we are going to read. See me, I'm going to be standing there with my book. There, so that we save time. Professor Musaba is saying I should announce. I had announced in the morning, but I don't have my, let me read it again. Yes. The sessions which are going to be here, we have, here we are going to have 13B, check the book, 14A and 15A. You're remaining here. The book, 13B, 14A, 15A. That means 13A, 14B, 15B, we are in the other venue. And the chairperson should make sure that all the people present have presented. So I request the chairperson, Dr. Masaba, to lead his delegation to the next reception. The dean is here. This is the chairperson I'm talking about of that session. I'm looking for the Dean, Faculty of Engineering and Technology, Engineer Dr. Dumba, to remain with the session, which is going to remain there. So, if you are not a presenter, feel free to join one of the platforms that you would love to hear about what they are presenting. Well, let's use 2 minutes to readjust to where we want to be. Those who are going to present here, please bring your presentations. Those who are here, please bring your presentations to Dr. Andy Moses. Those who are going down there, the gentleman is there called Mr. Chris Bagore. He's done receiving the presentations, so as you go into that space. I'm just waiting for the chairperson for this session to start. Anyone who is keeping Engineer Dr. Dumba. So far, we have received the 2 presenters, Professor Mukunya and Dr. Kirol, right? Yes, let's go in that order. So since Professor Mukunya is ready, he will be the first to start, but the chairperson has the...
Hi everyone, session chair here, Engineer Dr. Joseph Dumbaranyag. We have a number of presentations here. I pray we attend and participate actively. And we are starting with David Mkunya here, Associate Professor. David, start at the earliest opportunity.
Thank you so much. My name is David Mkunya, and I'm here to present work that we are doing. We haven't finished the trial, but we're in the process of the trial, and we realize it's always good to share some of the work we are doing, because we can get a number of pieces of advice as we go forward. And I'm presenting this on behalf of a large consortium. Some of the members are in the room. I'm sure you can notice the gentleman in the extreme right who was our keynote speaker. We have Dr. Martha in the room, Mudua, who's a PhD student on this project. And we also have Professor Milton Musawa, who's also with us. And some members are not here with us. Okay. Okay. Most children who die within the first month of life. So neonatal deaths account for 46% of all under 5 mortality. And this is a big challenge. Not only is it a big number, it's also a constant number. If you look at our last 3 demographic and health surveys, that number has not changed. And one of the big reasons that children die, neonates die, is that they are born too early. They are preterm. And who is a preterm? Pregnancy should go to at least 37 weeks. Yeah? But some children are born before 37 weeks. In other words, they are born too early. And there are those who are moderate to late preterms, those from 32 to 37. Usually there we don't have so many problems. But then we have the very preterm, those who are less than 32 weeks. Those are very big problems. One, because they are organs that develop late. Organs like the lung, to become fully functional, this happens towards the end of pregnancy. So when they come out early, their lungs are not yet adapted to live on outside. Their skin is not ready to protect them from bugs, you know. So these are extremely vulnerable, especially the ones less than 28 weeks. And everywhere, about 10% of all births are preterm. So it's a big problem. So if you count 10 women, one of them will have a preterm. It's that common. Yeah. And what can we do? What can we do to reduce preterm deaths? So the WHO came up with new guidelines in 2022. And one of the things that it asked for more evidence was on the issue of emollient. And what's the question they asked? They said, if researchers can help us answer this question, would have moved a step forward. At least we'll know whether this information works or we'll know whether it doesn't work. But it's a key question. What's the effect of emollients on mortality, on sepsis, on growth, on thermal protection, especially in Africa? Why especially in Africa? Because in Asia, they use oil all the time. Even in Africa, if you go to Soroti, shea butter is used frequently. So the idea of emollient, it's not that it's very foreign in Africa, it's just that no study has been done to assess its effectiveness in Africa. Yes. And we have evidence from Asia that shows that this is beneficial. Unfortunately, Here in Africa, we don't have that evidence. And before we did this study, we went out to ask another question. The question was, what are the emollients that are being used in Africa? You know, so we did a scoping review. It's published. You can go and look it up. And even from the scoping review, there was very little work that had been done. The second question was, is it acceptable? You know, you can bring your emollient. Emollient is, just take it like oil. Any oil that we smear on the body. So that second question was, is it acceptable? So we did a study. This was one of our brilliant master's students about the perceptions, beliefs, and practices regarding emollient. And this was actually very acceptable. We were asking two questions. Number one, would you mind your baby being smeared with oil? We asked mothers of very low birth weight. And number two, we asked them, would you want us to massage your baby? So they said, smear the oil, don't massage the baby. Because they fear as you're massaging, you could break their bones and their, So, the message we took forward that message. So, we wrote a proposal. It was really emollient therapy for very low birth weight infants in Uganda. And we wanted to see its effects on survival, infection, growth, and development. And in this particular study, we're using sunflower seed oil. Sunflower seed oil. When you have very low birth weight, those are babies who are 1.5 kilos and less, you smear them in oil while they are in the neonatal unit. And the precise objective is that, it's the same as what I've said before, and we are packaging this oil in these bottles. And we have some oil around. We have one of our brilliant PhD students around. We may show some of you the oil we are using. But we emphasize that it's actually a medicinal product. So someone doesn't go to the supermarket, buy sunflower seed oil and washes the baby. No. This is actually a medicinal product because we are not sure whether it actually works. Yeah. So, and we label those bottles. It has a dosage, 3 milligrams per kilo. We say it's topical use only. Don't put in contact with the eyes. That's the sponsor. We put contacts of the principal investigators and a telephone number in case you get any challenges. So just make sure that this is still an investigational product. Yeah. And it's the trial is being done in the neonatal intensive care unit. Let me summarize. That is at the end of 5 minutes to go. 2 minutes to go. All right. And I'm about to finish. And so far we have screened 124 babies. We have recruited 64 babies. And these are the numbers we have. We have discharged 36. We have lost 7 children. And 47 of our babies are 1 kilo to 1.5, like a kilo. Imagine a kilo of sugar. Yeah. And 17 are less than, they weigh less than a kilogram of sugar. And what has been our challenge? Our biggest challenge has been the recruitment has been slower than we anticipated. Yeah. And for those who would want to see the oil we are using, we'll pass it around so that you touch it, feel it, and smell it. And we will continue updating you of the progress of our trial. Yeah, that's it from me. Thank you. And these are the partners that we are working with. It's being funded by the Research Council of Norway. Torkil, who was our keynote speaker, is the chief investigator. Dr. Kathy Bogoine and myself are the local principal investigators. We have so many people that we are working with, and I also mentioned Dr. Martha, who is a PhD student on this project. Thank you so much.
Thank you, David. I hope, colleagues, I want to inform you that keep the questions we shall ask at the end of the session. But I want to remind you that you have 10 minutes. When you hear the bell, that you have 2 minutes to go. I want to know whether Hassan Kasuja is here, Anthony Kadu, Kulibali, Namudu, and Amayo. Are we here? So if those are not there, I'll proceed. Do we have Gertrude here? Yes, Gertrude, please get close, get close, get close. Gertrude, Jane Gatwiri, Catherine Asasa, are they here, please? Mugume, where is Mugume? I want to deal with whoever is here such that we'll catch up on time. Okay, Mugume is here. And the floor is yours. Please start. The clock is ticking, Mugume. If Gertrude is ready, Gertrude should start. Then that we can look for it later. To save time.
All right. Thank you so much, the rapporteur for this session. My name is Mugume Emmanuel, a medical student from the Faculty of Health Sciences, Busitema University, pursuing bachelor's degree in medicine and surgery. I'm glad to have this opportunity to share with you our work as Busitema University about piloting a culturally sensitive behavior change strategy to enhance maternal and child health in Eastern Uganda. I worked with a couple of colleagues, students, together with our supervisor and our faculty dean. So the problem is there's been an improvement in maternal and child health indicators in Uganda, though they still remain poor or they still remain low compared to the targets. And if we try to look at the results here, when you try to look at the current maternal mortality ratio of Uganda as per the maternal and perinatal death surveillance and response, right now it ranges to 189 according to the financial year 2022-2023. This is way below the SDG goal of having it around 70. The skilled birth attendance is improving, it's at 91, but the goal is to have it at 100%. The facilitated delivery rate is it's also at 91, but the goal is to have it at 100%. So we still have, the indicators are still low, though there is an improvement. So a research study was done in 2023 in Eastern Uganda, and a qualitative research study showed that cultural beliefs and practices hinder uptake of these programs. It is basing on that study that we thought it wise to pilot, to try to find out, try to see whether we can get a culturally sensitive approach to improve awareness and outcomes in order to solve some of the indicators. And that is our main objective, to pilot a culturally sensitive community-led strategy to promote awareness and mindset change about preeclampsia and postpartum hemorrhage, them being the leading cause of maternal mortality. Hemorrhage carries 40%, and hypertensive disorder is a second leader. Hypertensive disorders like preeclampsia are the second leading cause of maternal mortality. And yesterday we saw the fourth leading cause, which is abortion. So we also try to, and this is what we did. We did a baseline survey in Kawanga, Sibutebo district, and the survey was mainly because we knew that their cultural beliefs, based on the study that was done the year before, in 2024, that their cultural beliefs, their cultural myths in Eastern region about preeclampsia, about PPH. So our study, our baseline study was quantitative. We just wanted to know the level of awareness to guide us on the cultural sensitive strategy we are going to pilot. So we did a baseline study where we purposely recruited administrative units, mainly the cultural leaders, the clan heads, and the VHTs and the local council administrators in the study. And then we subjected them to a tool, an awareness tool, where you set questions about the dangers, risk factors, and maybe signs and symptoms of preeclampsia, and also signs and symptoms of postpartum hemorrhage, and you assess whether they know them. Maybe you set like 10 questions about preeclampsia and 10 questions about PPH, and you see whether they know them. And we, based on the previous research, we could compute the percentage. If someone gets 10 out of 20 questions right, that's 50%. And based on the previous research that was done, we took our pass mark of being aware or having knowledge about these preeclampsia and PPH as 70%. So anyone who scored 70% in our questionnaire about the signs and symptoms, about the risk factors, about the dangers, was taken to be aware. Anyone who scored below, we took them to be unaware. And the The baseline study, we got a percentage, the awareness of 8%, 0.8%. So that also was a backup to the research that was done in the year, the previous year, that there are underlying myths and cultural beliefs about preeclampsia. And we sat down as students to design a health education intervention to these community leaders, to these cultural leaders, to these clan heads, to these local council administrators, to educate them about preeclampsia. So we did educative plays, skits, about the myths, and then what should be done. What should be done? And after that, we subjected them to a post-interventional questionnaire or survey. And if you can see the results, this is the model A that is occurring, I can say. That when you have in your engagement, if it is the health team members, together with the community members, we saw that the outcome of awareness was 8%. This means that out of every 100 people, only 8 scored 70% in the questionnaires we administered to them, using this ordinary model, I can say, the model that we're using right now. But when we did our multi-sectorial engagement, where we had academicians, that is us, the health teams, the cultural leaders, and the community members, we demystified and improved the awareness. When we subjected them to the same questionnaire after a period of 2 weeks, they were able to know the dangers, the signs, and the risk factors of PPH and preeclampsia. So this was a pilot study as students. So we used every cultural association, medical student cultural association, played a skit in the local languages to these leaders, telling them about their myths that we identified from the previous research study, telling them what should be done, what is the real health education knowledge, and to improve. In so doing, we managed to get those results, the improvement in awareness. So I would like to acknowledge the key stakeholders of the university that helped us with the funding, that gave us this idea to pilot a study about maternal and child health indicators improvement that is culturally sensitive. The top management, right from our Vice Chancellor, our dear Dean, Seed Global for funding us, the district health team of Butebu, and also Bugwera Royal Kingdom, which the Prime Minister of Bugwera Royal Kingdom honored our study and participated actively. Otherwise, thank you so much.
Thank you, Emmanuel, for that presentation. I've been reliably informed we have the colleague from Ivory Coast online. Moses, you can confirm if we can have him. If he's not ready, Gertrude is here, more than ready. Can he hear me? Koulibaly, are you there? Are you able to hear us? Moses, do I need to be there? Or can he be ready in the next 10 minutes? Let's have Gertrude. And someone should maybe privately contact Koulibaly to be ready in the next 10 minutes. Gertrude, please, the floor is yours. You're welcome.
Good afternoon, ladies and gentlemen. I'm Nakato Angela Gertrude. I'm going to present our findings about this study, the prevalence and factors associated with pneumonia among children under 5 attending outpatient department at Bududa General Hospital in Bududa district. So I didn't do the research alone. I had 7 other people with me, together with my supervisors, Dr. Lisa Rin, Dr. Imalingat Julius, and Miss Init Kawala. So this was the background. First and foremost, pneumonia is a respiratory disease caused by inflammation of the parenchyma lung tissue. It's a leading cause of morbidity and mortality in children under 5 worldwide, mostly affecting the low-income settings. So in Uganda, it accounts for a significant proportion of the outpatient visits and child mortality. So in this study, this was our objective. We determined the prevalence and assessed the factors associated with pneumonia in children under 5 at Bududa General Hospital. So this was the method we used. It was a cross-sectional study design where we used both retrospective OPD records and individual case data. We viewed records from January 2024 to May 2025. That is a period of 15 months. And that's what we used to determine the prevalence of pneumonia in Bududa. And then we visited 28 individual pediatric families, cases, and we analyzed for the associated factors, which included immunization status, ventilation in the house, fuel used for cooking, overcrowding, and the parental education. So pneumonia diagnosis was based on the clinical records, and these were the symptoms we were considering: fever, cough, difficulty in breathing, shortness in breath, and the data was summarized using descriptive statistics, and associations were assessed from cross-tabulations. These were our findings. So the OPD visits, our total OPD visits were 3,882 from January 2024 to May 2025. And out of them, there were 820 cases of pneumonia in children under 5, and that yielded a prevalence of 21%. The prevalence kept varying, though we realized that in some months it was a little bit higher. February we had a prevalence of 40.6%. In April, it was 31.1%, and in May, it was 34.3%, suggesting seasonal trends or outbreaks. Among the individual cases we reviewed, pneumonia affected both sexes, though it affected the males more. We noted that 57.1% of the children with pneumonia had not been immunized, so it was showing a gap in the immunization coverage, and 71.4% lived in non-ventilated households. 85.7% used firewood. So what we're trying to find out is use of firewood associated with this pneumonia in these children. Some of them in these families that used firewood were affected and some were not. So 85.7% were affected. And most of these children came from families where the parents had low educational levels. I think that also explains the immunization gaps and, yes, the immunization gaps. Those were the graphs showing the different trends of pneumonia affecting those children under 5 and the months that were mostly affected. So in conclusion, the prevalence of pneumonia in Bududa was notably high. 21% is quite high. Yet the one of Uganda is 25.7%. So there is something wrong. The associated factors, we had lack of immunization, poor household ventilation, use of firewood, and overcrowdedness in the house. So these findings highlight the need for public health interventions focusing on immunization, improving housing conditions, and cleaner energy resources or sources to reduce the pneumonia burden among children under 5 in Bududa. Thank you.
Thank you, Gertrude, for the presentation. Dear presenters, don't go very far. Later, you'll give us a take-home message and take a question. Then we shall conclude. Simon Peter Okirol, are you here? Yes, please. The floor is yours. Use 1 second to get here. Simon, take your seat. I'm told Kulibali is here. Sorry, Simon.
Hello, Kulibali. It's your turn now. Would you like to share your slide? Anybody can hear me? Would you like to share your slides now?
I think Kulibali should be last. Let's, because we are breaking the floor. Simon, please.
Thank you. Good afternoon, ladies and gentlemen. I'm Simon Peter Okiror. I'm sharing this presentation on behalf of our team. With me here is Geoffrey Triasingura, our principal investigator, and I'm the co-PI. And there are many others I will introduce later at the end of my presentation. Okay, thank you. Sweet potato is one of the most important food crops in Uganda, and particularly in eastern Uganda, where Teso and probably Busoga sub-regions are the leading producing areas. It is produced mainly as a food crop, but it's been increasingly grown as a cash crop, as well as for feeding livestock and manure, among other uses. Now, it is used as an industrial product is also a point of our presentation here, because for long, sweet potato has been used mainly for food, but as raw tubers. In this scheme, in this chart, we see that there are many products that we can generate from sweet potatoes, other than only tubers for food and maybe some small-scale processing. In Teso sub-region, the processing which is done is basically to slice it into the dry products called amukeke in Teso, and then the refuse is used to feed livestock and maybe used for manure, green manure. But we want to tap into the bigger part, which is the lower part of this diagram, to engage into research into products that we can get through industrial processing of sweet potatoes, specifically the orange-fleshed varieties, which are rich in beta-carotene, a precursor of vitamin A. Our idea is that we want to move from this left-hand side where we have the tubers and come up with the value-added products more to the right, which include high-quality flour, sweet potato puree down here, the flakes, cubes, and even some liquid products, baby foods, and so on. This has not been done in our country, and so we requested for support from STI, and they are willing to establish for us an agro-science park. The minister just alluded to it earlier on in her opening remarks. So we want to do this as a university, because in any industrial production, sourcing raw materials is very key. So we want to be the lead producers of the raw materials, the sweet potatoes, but we're not sure whether the soil we have is good enough for sweet potato production. So it required us to do some studies to establish the suitability of the land we have as Busitema University, Faculty of Agriculture in Arapai. And should we find that even our own output is not enough, then we should be able to engage the wider community, starting with the Teso sub-region, and therefore we needed to establish what is the current status of production, consumption, marketing, agro-processing, and what challenges do farmers in Teso sub-region face. And that's why we had to conduct this study to come up with some answers to these objectives. For the soil nutrients analysis, samples were picked from various points in the Arapai farmland, and then they were taken for further analysis in Kawanda, National Agricultural Research Laboratories, Kawanda, and then several procedures to look at different nutrients were done. Then we conducted a survey, baseline survey, to assess the production and marketing challenges and other issues regarding sweet potato production and marketing in Teso sub-region. This was in 8 districts out of the 11 districts in the Teso sub-region that were randomly selected, including Soroti, Soroti City, Serere, Katakui, Amura, Kumi, Bukedi, and Kabremaido. We selected the 2 sub-counties from each of those districts and at least 2 parishes per sub-county, where at least 50 sweet potato farmers were selected randomly to participate in this study. After cleaning the data, we arrived at a sample of 106 respondents. This data was collected between August and November last year, and we used pre-tested questionnaires in COBOGs, and then the analysis was done using Stata and Excel. So for those who are not familiar with the location of Teso sub-region, that's the place. We are slightly down here at Bugiso. The key results here are that majority of our respondents in this study were male, almost 2/3, and the average age was dominated by the young population, between 18 to 40 years. That's around 40%. And then most of them were married. And in terms of education level, majority had a primary education. So when the results for soil analysis came, the pH was indicating on average 4.6, but it ranges from 4.3 to 5.3, which is slightly acidic. And then the organic matter content was favorable. Other nutrients were showing good performance apart from phosphorus. In this chart, we try to compare the recommended levels of nutrients with what we found. We find that apart from phosphorus, most of these other nutrients were performing relatively well, and more so when it comes to organic matter. It was slightly above the recommended for sweet potatoes, but the pH was not very much suitable, slightly not conducive for the sweet potatoes, so some action needs to be done there. Part of that soil analysis included coming up with the soil maps to specify which locations in the university land has all those nutrients I've just highlighted. And that middle line is the swamp, the line that divides where the land that we are designating for the AgroScience Park. Below it is likely to be occupied by the factories, and the sweet potato will be one of the residents in that AgroScience Park that the minister was talking about earlier on. In terms of the field work that we conducted, the production showed that most of our farmers are cultivating small plots, about on average 1 acre, and getting roughly 1 ton, but not exactly, at least 891 kilograms, which was going at around 54,579. Okay, thank you. Maybe 1 minute, I wind up. Okay, thank you. Sure. We try to look at their production dynamics, the timing. We find that the majority of them plant in the first season, a few and some in both cases, a few in the second season. The varieties they grow are mainly the white-fleshed, and at least a third go for orange-fleshed varieties. We used photo albums to help them identify the varieties, the pests, and the diseases. And for the reason, it is mainly for food consumption, and then some sale, and a few others. Then, in terms of the major pests, we saw the sweet potato weevil as the major one, and then the sweet potato hornworm. And on diseases, it was the root rots, which was the main problem. Then the control strategy was basically cultural and chemical, but the majority of them were not able to use any measure. They just leave things to God. So very unfortunate. So there is a need to do that. So thank you so much. So in conclusion, I say that the land is suitable for sweet potato production, but with some attendant activities that need to be taken, especially with regard to soil pH, and then phosphorus levels. And then the region has the capacity to support sweet potato production commercially, to support the agro-science park. But as we can see, the orientation is on white flesh varieties, not the orange flesh that we are interested in. So there is going to be more work on that. So the recommendations relate to those observations. And this is the team I was talking about. We are quite many, but all of us are in the Faculty of Agriculture, agriculture and then animal sciences. We have 3 departments, so they are all indicated there. This was part of the exercise, picking the soil samples in the land, and then that is the team after the training for field work. So thank you so much for this time.
Thank you, Simon, for the presentation. Thank you so much. Up next, Professor Mwanja. Prof, you're welcome. Professor, you've used 1 minute.
You do date. The date, whatever. The most recent. Go down, should be down. Date 1, 5, that one. Good afternoon, ladies and gentlemen. I'm here to switch gears a little to something sweet. That is the fish. Are we okay? Okay, at least you can see me. Yeah. The PowerPoint. Yeah, that one. Let me sit down. You go up and sit. Bear with us, we have a technical glitch which we are clearing. Do you have a flash? I bring another one. Copy. From my flash, from my computer. Or I bring my computer. A little computer. Yes, Koulibaly, we are able to see your slides. Kindly hold for about 10 minutes. You're up next. Professor, you've used 2 minutes. We are good to go. Please start.
Okay. I'll run through this fast, try to catch up with time. Here we've been working with a Dutch company on trying out an organic treatment for fish against parasites. And recently in Africa, there's a big rush to have aquaculture compensate for the dwindling capture fisheries, and of course the growing population to make sure we have nutritious food. One challenge in aquaculture is, of course, the fish health. And unfortunately, most of our farmers, especially smallholder farmers, who are over 90% in most of the countries in Africa that are engaged in aquaculture, have limited knowledge or lack knowledge of fish health. To many of them, they don't see the baby. They don't see the fish in the water, so they can't imagine the fish falls sick. But that water is infested with a lot of parasites and other pathogens. Aquaculture today can be talked of as a means of meeting the nutrition needs. Of course, many of you here know that fish has some quite essential nutrients that are needed for our health. And capture fish, as I said, has stagnated. And in Africa, in most waters, actually it has collapsed. And aquaculture production has gone up. But this story is not the same across, especially in Africa, because of some of these challenges. In Uganda, we are currently producing about 101,000 tons from aquaculture alone, compared to about 400 to 500,000 tons from capture fisheries. The challenge of parasitic infections, common among these, of course, is trichodina, Glycodactylus, and others. And the effect is that they limit the fish health, welfare, and productivity. They cause economic losses, enormous economic losses in hatcheries. One of the really challenge of picking up aquaculture has been a steady and reliable seed, quality seed supply. When we talk of seed, we are meaning the fry, the young that you put in the pond to grow the fish to table size. Of course, most farmers who are a little aware turn to chemicals. Those what you can buy from the veterinary shops. But most of these chemicals elsewhere have been banned. They are most and they cause other effects on human health. But when you have nothing to do and you're going to lose your business, you turn to that. So environmental and regulatory risk demand safer alternative. And this, of course, the market is becoming more aware and more informed a bit in Uganda, and there is a push for eco-friendly measures in managing health of animals, including fish. These regulatory restrictions, even in our books. Of course, the enforcement is another aspect, but we have the laws against most of these chemicals. There's a demand for safe, effective, and biodegradable products that again won't pollute our waters, and farmers, of course, require practical and cost-effective options. Working with a Dutch company, they came up with an organic compound called Biocos, which is non-chemical and it easily degrades, and you don't have to apply it for a long time. It's natural, biodegradable, and parasitic compound developed by a Dutch company, and you provide sustainable parasitic control in aquaculture. And of course, we are testing out with the farmers in what form or mode they would rather have this. Our goal was to, of course, enhance fish production and productivity through a One Health perspective. Those in health are quite aware of the approach now to try to get the animal, the environment, and human in that One Health perspective by developing and evaluating sustainable, environmental friendly and parasitic solutions that are effective, easy to use, and cost effective. In our trials in Uganda, as the law, when a product comes in, we have to test it in Kajansi, our leading aquaculture research institution in Uganda. And we did this by exposing the fish, the normal fish, to parasitic pressure. We evaluated the parasite load reduction. Then we applied the biocos. We considered and evaluated the fish welfare and the resilience that develops against parasites after that, and assess the economic models for scalability across the country and, of course, in other countries in the region. These are some of the pictures of the work at Kajansi. KRDC, ORDC is the Aquaculture Research Development Center. It's part of the NARO Institutes, the National Agriculture Research Organization Institutes. So we first carried out an on-station testing of the efficacy of this chemical against the parasites. Parasites were got from our Ugandan ponds, waters, and we got the fish right from the hatchery, which was not infected, and ran the experiments. In interest of time, I won't let the video run out. The idea is gone. More pictures about the experimental setup. We're now conducting field trials in the farmers' ponds and how to really mode of delivery of this treatment against the parasites in the ponds and in the hatcheries. These are tanks within a hatchery, fish hatchery. Fish hatchery is where you produce the young to supply to farmers. In short, the results were very effective, and we found that this compound is user-friendly and has minimal impact on the fish itself as well as on the environment in which the fish is being cultured. This is a graph of that data translated into visible explanation. Up we have the positive control, where you really put the disease, the parasites and the fish. The second one is the The second one is the negative control, and then again we are studying the number of tablets, because it comes in tablets, powder, but for this particular study we're using tablets. What is most effective? Of course, you see here if it goes to 2 tablets in 1,000 liters, again it affects, it clogs the gills of the fish, and they are not able to breathe, so you get mortality. But we found that most effective is the 0.5 tablet in 1,000 liters, which makes the cost lower. So, biocos is non-toxic to the environment, it's biodegradable, it aligns with the international and regional sustainability frameworks and reduces dependence on harmful chemicals like formalin. In conclusion, biocos shows high potential as a sustainable anti-parasite treatment. We have demonstrated the efficacy, safety, and user acceptability, and biocos adaptation enhances practical relevance. Next steps. I want to acknowledge the Ministry of Agriculture, NARO, which is where RDC is, the Nafiri Fisheries Resources Research Institute, and the European Union for the funding. Thank you.
Thank you, Prof. Manja, for the presentation. Dear everyone here, dear participants, we have one more to go. That is Koulibaly online. I hope he's still there. Moses, do we still have Koulibaly? And And my presenters shouldn't go very far. They'll come to give us a take-home message and also answer one question.
Hello, Kuli. Okay. Good morning, everybody. You understand? Hello?
Yes, we're getting you. Good afternoon, Ugandan time.
Good morning, everybody.
Yes, Kulibali, good afternoon.
Good morning.
It's about 2 p.m. sharp in Uganda here. Are you able to hear us well? Kulibali.
I'm Kulibali Lirea. I come from, I'm from Ivory Coast, Côte d'Ivoire. My presentation concerns spatio-temporal variability of temperature in the mountain district, Western Côte d'Ivoire from 1961 to 2020.
Kulibali,
You understand me?
Sorry, Kulibali, do you hear us? Have it in presentation mode. Can we have it in slideshow? Your presentation.
Please, we can hear you. You can continue.
Okay, thank you very much. Our country, Côte d'Ivoire, has experienced intensified climate variability since the 17th century. Persistent decline in rainfall and rise in temperature observed across West Africa. Most previous studies stopped before 2000 to 2050. This study extends the analysis to 2020 to assess recent trend in the mountain district. My objective is to analyze the temporal evolution of temperature, to detect breakpoints and trend shift in temperature series, map the spatial distribution of temperature variability, and so on. The study area is Western Côte d'Ivoire. We have district de Montagne, and we have in this district we have region Guémont, Kabali, Tonkwi. We have Man, Danane, Giglo, Diokwe, and we have humid tropical island with a strong north-south thermal gradient. We can see some locally petit test and frequency change. We have localities. Strongest warming Man, Giglo, and Danane. We have clear north-south gradient, cooler in the north, Biankuma Sipilou, 24 degrees. Warmer in the south, Tai Giglo, 27 degrees. We have decadal Israelite show a 1 degree rise between 1961 to 1970 and 2011 to 2020. Highest warming recorded during March, April, and November. We have a map with decline on our study area. We have another result. We notice that we have augmentation of temperature. Our result confirm an accelerating warming trend consistent with regional climate change. The main drivers are deforestation and land use change, reduced rainfall and evaporate transpiration, global warming impact, ITC displacement, and local consequences, soil drying, reduced agriculture, productivity. What we can retain, we can this is warming at 0.2 degree per decade. Temperature increase are heterogeneous, and our adaptation priorities is water management. Our work in the future will concern integrated climate modeling. We want to develop downscaled projection for local planning, and we have to acknowledgement University of Man, Nangia Brugua University, Ostom, and Terra Climate Data Provide. Thank you for your disponibility.
Thank you for the presentation, Coulibaly. I hope you can hear me. ICT, can Coulibaly hear me? Coulibaly, can you hear me?
Yes, I hear you.
Okay, take home message. In one sentence, Coulibaly, take home message. And in the audience, does anyone have a question for Coulibaly?
Yes.
Coulibaly, summarize what you've done in one sentence. Take home message in one sentence.
Message.
Okay, we shall get back to Coulibaly. Now, Prof. David, take home message and you'll take one question. As Emmanuel prepares, followed by Gertrude.
Yes. My take-home message is that as young scientists, we have a responsibility to question the practices that our fathers have passed on to us. So a practice like routine application of oil should be subjected to the rigor of science, and we assess, because we may be overlooking a lot of wisdom that is in our communities. So let us not just let's not treat all practices with contempt, and let us not also embrace everything wholly without subjecting them to scientific inquiry. Yeah.
Prof, thank you for that. Indigenous knowledge is very important. One question for the professor. We move the mic around. There are two. Professor, since you're near, you'll use this one.
So it's about the scent, like you gave us to really have the sample. It's about the scent. I think it's more towards groundnuts. Is there a way you can improve that scent? And then when they're applying the emollient, according to your indications, you're like they shouldn't apply it in the face. And as you know, mothers, they would love to really smear the whole body from face to the rest. So how are you going to tell them that smear this child and you spare the face, and what will they do for the face?
All right, thank you so much. It's a very interesting question. Currently, in the research setting, it's the midwives who apply the oil. Thereafter, we teach the mothers to apply it under observation. So there we can observe that they are not smearing around the face. And after that, we take the oil and put it in under lock and key. Yeah. So in the trial setting, at least we are sure it's not going to be misused. But after the trial setting, then we have to think more creatively, because we know from our previous research that mothers are really, they really want the baby's face to shine, maybe also fathers. So actually, if they were to smear in one place, they would want to smear the face so that they get good compliment from the other people. So I think we have to look for a product that is safe to be used around the face, or probably also study the effects of this oil around the face. Yeah. And the smell, that one we'll take it back to the, we'll discuss with the manufacturers to make it better. It's a little bit funny because some people like the smell, some people don't like the smell. So, but we will, the good thing Martha is here. Martha, write down those comments. You're the PhD student here. There was one more question. Okay, thank you.
We have a networking session. The professor is always available. Engage him. In the interest of time, let's have Emmanuel to summarize. Participants online, please hang in there. We shall come to you after the ones physically here.
The take-home message is culture has a dual impact on maternal and child health. So the setting we are in right now, the myths, we need to, if we don't embrace and demystify the myths, our maternal and child health indicators will remain low. Because most of the target populations we are trying to look at are strongly affiliated to their cultures. So we need to work with the culture, we need to work with the communities in order to improve maternal and child health indicators. Because if we don't, they are going to persistently be low. If we bring them on board and they engage in a community-led improvement, we shall have the myths demystified and we shall improve maternal and child health. Thank you so much.
Participants, take-home message is one sentence. Okay, you had Emmanuel. A question for him? Okay.
Yes, thank you. Thank you, Emmanuel, and I commend you for the work you're doing since yesterday. I've been following, but there's one thing that has consistently come out in your presentations. You've been referring to financial year, financial year, financial year. I don't know whether there's something we're missing, whether you've done cost-benefit analysis in your studies, and that's not coming out. That's one. Then two, in this past presentation, this is very important, sir. It's very important, please.
That one or the first one?
They're very quick, they need quick answers, but this one is very important. This one is very important.
Let him answer the first one. Hand over the microphone. Let him answer the first one. One question, please.
Thank you so much. I've been referring to the reports that they were made in the financial year, but they're also consistent with the reports of the Uganda Demographic and Health Survey. So that is the basis. Not necessarily the financial, but they are in line with the demographic survey. Thank you so much.
Thank you, Emmanuel. If you need him to clarify on more issues, please get near him. Gertrude, one sentence.
My take-home message, pneumonia remains a burden and a leading cause of mortality and morbidity in children under 5. If we work on the immunization coverage and promote health-seeking behavior, then we shall be able to reduce the burden of pneumonia. I also forgot to thank SEED Global and Miss Enid and the Dean and all my fellow students. Thank you.
Am I facing a rebellion? One sentence. A question for, no, let's give Moses. She had a chance last. Moses.
Yeah, thank you, Gertrude, for the nice work. In your presentation, you found out that boys or men are more, are more likely affected by pneumonia than women. What is the scientific basis for that?
Well, this was baseline data, so we didn't, okay. I didn't go into details with that, but we are yet to find out more.
That is future work, eh? Thank you. Prof. Manja, one sentence, take home, then you'll answer one question.
Yes, we have a safe, sustainable solution to key parasitic infections or infestations for especially hatchery level fish production called biocos. Thank you.
One question for the professor.
Thank you so much, Prof. I have a simple question. Did you consider the varying water qualities while using the BICOS?
In the at Kajansa, of course, on stations like in the lab, we standardized everything. Now we are at farmer level and we are considering the different water varying conditions. That data we are taking, but unless when the water is very bad, it's still very effective. Thank you.
Okay, thank you, Professor. Simon Peter Kirol. One sentence and you'll take a question.
Thank you. What I can say is that the evidence we have generated from this study can now tell us what we need to do as a university and what other stakeholders need to do. On our part, I think productivity enhancement is key so that we can produce more sweet potatoes, especially the orange flesh types. And then we are very grateful to STI for the support to establish the agroscience park so that it can enable us add value to the sweet potatoes so that our people can benefit. I think that's what I can say.
Thank you, Dr. Kirol. One question for Simon. Simon did well. Thank you. We move to online. I need ICT to help me. Red Cross and the Kulibali, I think they are here to give us their take home. Kulibali, are you there? I'm told you can hear me. The colleague from Red Cross, are you there? Do you hear us? John, are you there? Okay. The power is vested to me. I thank everyone for actively participating and all the questions. I encourage you to follow up with the presenters, the scientists, for more clarifications. I now bring the session to a close. Thank you, everyone. The overall chair is here.
Let's clap for Engineer Dr. Dumba Rwanyaga for a very excellent work done, and our rapporteur Ivan Sebagala. Thank you very much for this. You can take our seats. may I find out if there is any presenter who has not presented? At least. Is there any presenter who has not presented? Yes. Any presenter, but let's be honest, I'm putting up my hand so that I know. 1, 2, 3. Can we send your presentations right now? I'm going to request you at least you give them a chance to present here. Only 3. You got a coupon? No, let's first finish. So please, let's be patient with them and they present the 3. He's number 1, she's number 2. Who has not presented and you're here? Please, let's hurry up. There are only 3. That means we should give you 7 minutes, no questions in that regard. Tell us the message.
You said no questions, eh? Okay, please. Dear participants, I had closed, but due to unforeseen circumstances, I think I should have used the word adjourned. But we have participants here, and they are preparing to disseminate. Where is the third presenter? I need all the presentations on the laptop. Oh, there are 2. What's your name? Bruno. Okay, Bruno Wamono is ready. Bruno, start as soon as possible.
Thank you very much, our panelists. Good afternoon, ladies and gentlemen. My name is Bruno Wamono. I'm a student of Busitema University, Arapai campus, and I'm doing Bachelor's of Science in Agriculture, my final year. In the shortest time, I'm coming with a business enterprise, which is not only a business, but one way of advancing various issues in our communities. Sorry for the interruption, and I think my minutes will be compensated. The title of this proposal is the Chicha Coffee Model for Sustainable Agribusiness in Eastern Uganda. We are all very much aware that Eastern Uganda is known for coffee as the major source of income for various stakeholders. I won't talk much about coffee, as you're all very much aware, and you always receive reports annually about the trends of coffee in the whole country. So what I'm going to focus on is about the involvement of youth, then also the coffee trends, like how farmers are benefiting really from this cash crop. So the first graph you're seeing is showing the age distribution of farmers in Eastern Uganda as far as coffee value chain is concerned. So looking there, we see that over 70% of coffee farmers are above 45 years, meaning the youth, there is a very big gap between the number of youth participating in coffee production compared to their parents who are soon retiring from the production. So the next graph also shows also the youth participation in the coffee value chain. We see that when you look at activities like coffee production, processing, value addition, marketing, and export, we find that the youth, who are the largest number in the country, only participate most in marketing, leaving behind the exportation and the value addition. So what I'm bringing on board here is how this youth, how should we increase that margin for the youth to participate in value addition and also export of coffee. So continuation with my background, this first graph you're seeing here is also showing the value share of the coffee. So looking at the exporters, the coffee farmers, then also the roasters, retailers, and middlemen, who takes the biggest share of the value of coffee. So looking at this graph, first graph, we see that exporters, they take the highest percentage of the value in the coffee. And this shows that only farmers take up only 15% of the value of the coffee they have produced and given to the what? To the exporters. The second graph there also shows a challenge we see in our community as Eastern Uganda, where we see the impact of climate change on the development. And this affects the production of coffee, meaning that in this graph we see a steady decline in three parameters. Which ones are these? We have the agriculture. In agriculture, we see that the impact of climate on agricultural production keeps on declining because of some of the solutions which are coming up, which my proposal will be part of that. So which gap am I looking at? We are looking at youth empowerment. Yes, the youth are there, and any company can employ them, but do they have the skills? So we find that in Eastern Uganda, we have only one coffee training institution, and that's the Uganda Coffee Farmers Association in Jinja. So another gap I'm looking at is the value addition and market access, whereby farmers are not being involved in value addition of their own coffee. So if farmers are to put in their efforts in value addition on farm, the value or the price of their coffee could increase by 20 to 30%. What I'm also focusing on is the farmer groups. We find that there are many farmer groups as far as coffee is concerned, but in these farmer groups, how many youth are being involved? You find that in a group of 50, you find 5 youth, which really shows youth are not participating in this value chain. What is caused when youth are not involved in the coffee value chain? We see that there is a lot of unemployment. Coffee value chain has a lot of employment opportunities, but youth are remaining unemployed. Why? Because they do not have the skills. Then too, they are not empowered enough in Eastern Uganda to participate in this. The next is the levels of value addition. Yes, value addition is important, but this is something which needs a skill. It also needs enough funding or enough capital to purchase the equipment. We also have vulnerability to climate change, of which it affects the production of the what? Of the coffee. So we also have income inequality. Yes, the farmers produce coffee, but at how much is their coffee being bought? And this is caused by still the previous point of the low value, the low level of value addition. Then what are we looking at as the Chick-Chack coffee model? We are looking at rural development. We are seeing that as we bring in skills, trainings to farmers, and also providing our service and products, we shall see that farmers are earning higher incomes, and we'll see that there is improved livelihoods. The second is youth employment. Of course, as an enterprise, which we've put in place, registered business. Yeah, thank you very much. We are looking at employing a number of youth, trained youth, and also building their capacity to involve themselves in coffee production and processing. Also, we are looking at campaigning on climate smart coffee production, sustainable coffee growing, and so on. So the approach we are following is entrepreneurship. This is through setting various enterprises dealing in the coffee value chain. We are also looking at adoption of green technologies, for example, solar drying, and also use of organic procedures or principles in production. We are also looking at infrastructure, where we are to lobby for coffee training hubs in Eastern Uganda. Then also we have capacity building through the training hubs, where we shall see that youth are getting skills in coffee production and processing. This is our progress. So far we have a registered enterprise, and we are doing more of youth training and empowerment. We are doing value addition and accessing the market, which is readily available. We have partnerships with a few farmers. Then there is environmental impact, where we are teaching people on climate smart farming. Then there's also visibility and growth, where we are trying our level best to push this to all media platforms. Our products, we have some green coffee beans, roasted beans, ground coffee, and parchment, which if you need a pack, you can pick it right from here. Then also, what do we look at in the future? You saw all the gaps I listed, and what we are looking at, the number one thing is seeing that Eastern Uganda gets a coffee training hubs in our local communities, so that a farmer gets coffee from farm, adds value, and it goes straight to the final consumer. We also look at technology integration and digitalization, where we shall look at ensuring that there is traceability for our coffee. Thank you very much. Before I conclude, just 1 second. We look at also product diversification, and also this shows part of what we've done and also what we are based on. Thank you very much.
Thank you so much, Bruno, for the presentation. The chairperson will pick the first pack of coffee. We hope to engage you much more. Bruno. And I hope your business cards are all over here. Okay, next is Immaculate Akrut. You're up.
Immaculate has used 1 minute. We had the third presenter. It has come. Immaculate, make your way here.
Good afternoon, ladies and gentlemen. All protocol observed. This is, I hope it's one. So this is a team of several people, and the presenter is Akurut Immaculate. We were looking at the effect of Moringa oleifera, seed meal, based rations on growth performance and then nutrient bioaccessibility. The growth performance was assessed on grower pigs. The focus here was on pigs. So the background to this is that the population, the world population, is growing. And right now we are at 8 billion, of course, 8 point something and so forth. What does that imply? More mouths to feed. And one of the nutrients that is lacking in most cases is protein. So when we look at livestock, we try to see which particular animal can provide the protein, maybe quicker than others. If we leave alone poultry, pigs are one of such animals because they multiply very fast, they grow very fast. But the challenge we are facing with pigs is that they feed a lot. They compete with man with almost the same feed resources. And therefore, we need to find alternative sources of feed for these animals so that they can, in the long run or in the short term, give us the protein that we desire. So one of such alternatives is Moringa oleifera seed meal. And this Moringa oleifera seed meal is basically a byproduct from extraction of oil from, extraction of oil from Moringa seeds. So as they are extracting the oil, the byproduct here is the meal. It is just like cotton seed cake and so forth, but it's one of the things that have not been utilized in animal feed, more so in Uganda. So we're exploring this. So the main objective or the main aim of this, I will just look at the objective to assess the effect of different inclusion rates of Moringa oleifera seed meal on the growth performance and of the pigs, and then also on nutrient digestibility. Because when we are looking at these different feeds, it's not just that they are providing or they have the nutrients in them, but are the animals benefiting from those nutrients? That is why we look at the digestibility. So the methodology, it was an experiment that ran for 12 weeks, and it was a CRD, completely randomized design. We had different treatments and a control. The control didn't have any Moringa oleifera seed meal. Then we have inclusions of 5%, 10, and 15%. So the results, when we first look at the approximate analysis of the individual ingredients, some of the major ingredients that we used, we note here, we see here when we are looking at the performance of this particular ingredient in question, we see that its protein content is competing with that of fish. It is very superior to the soybean meal, and yet it is also a plant source protein. So it has high nutrient content. And then, of course, when we mixed, we also assessed the rations, the mixed rations. And the key thing I wanted to point out here is that the reduction in NDF and ADF, acid detergent fiber, and then neutral detergent fiber. These are fiber components. For pigs, they are monogastric animals. They don't utilize a lot of fiber. So reduction in it is good enough. So when it came to feed intake, here we're using feed intake to assess palatability of this particular feed, and we saw that there were no significant differences between the different treatments. So this showed that actually the inclusion rates did not affect the feed intake. However, we noted that when you look at the time taken to actually complete the feed, as the inclusion increased, the time also taken to actually finish the feed increased. So for weight gain, yes, although most of the weeks did not, because this was a 12-week experiment, most of the weeks did not show any significant differences between the treatments, but specifically we look at week 5 and 6 and then 11 and 12. There were differences, and if we look at this graph, we see that at least there was a positive growth curve. The pigs were actually growing, gaining weight as they were actually consuming this feed, which is a good indicator of this particular feed. So when it comes to digestibility, the actual benefit, apparent digestibility, we saw that it increased with the increase in the inclusion. Maybe this was also, yes, it increased because of we could assume that probably the nutrients were more available with the feeds which actually contain more amounts of the moringa. And then when it came to nutrient digestibility, the individual nutrients, we saw that the treatments were superior to the control. So they facilitated more nutrient digestibility as compared to the control. Then the take home for this is that moringa oleifera seed meal actually contains nutrients which are essential for growth of pigs. This study suggests that inclusions of 5 to 10% are actually okay. They are safe. And then the final one is that this particular feed can be used as an alternative feed in management or in feeding of pigs. Currently, if you go to retail shops, it's not there. Actually, it was their first time to also see, because I went to mill it where they normally do their things. So they were curious to know what actually can be gained from this particular ingredient. Of course, there are other things that remain to be done. For example, recommendations. Among the recommendations, there is need to do more research on the anti-nutrients. Never know that if we introduce methods that actually reduce these anti-nutrients, we could even experience a better nutrient digestibility in as far as this is concerned, plus other recommendations. I think that is it. Of course, I acknowledge FAST management and staff, Buri for funding, COVAB where some of this work was done, and then the entire research team. Thank you.
Thank you so much, Immaculate. We shall have more meat to eat. We had a third presenter. I've been searching for the person for the last 20 minutes. Dr. Pio here tells me in vain. And dear participants, I thank you for bearing with us and for your patience. I take this opportunity now to adjourn the meeting. Thank you so much.
Good afternoon, ladies and gentlemen. I want us to get organized for the closing ceremony. I'm trying to trace my dean. Anyone who is hiding my dean should be able to release him to this place. Our director graduate school is in the building already. Let me also assume that all of you presented, at least you have got your certificates. If you have not yet got your certificate, by show of hands, is it because you don't know where it is or because it is not there? If it has an error, then the error we can correct, right? Number two, let me just put some on the issue of certificates. Some people had 3 presentations, and it would be very hard here to print 3 certificates in the same name. What for? 3. In the same thing, it really could not make sense. So we chose for you 1, if you were a presenter. If there's a problem in the name, we shall correct. You just return it, indicating where the challenge is. Again, I want to ask, if it is completely missing, then Mr. Ndamonyaka list is there. You can reach out to him. Again, they are being served everywhere. We are going to do a photo session to save time. That's what we are trying to do. So I'm only waiting my dean to join us here, and then we shall start the closing ceremony. In the meantime, the DJ can give us anything so that we are not so bored. Or I know we are.
It's a bit of dozing, but I won't take a lot of time. I'll try to be as audible as possible. My name is Colin. I'm a strategy and innovation specialist from NSSF. And today I'm here just to, because one of the main reasons I came here is to start a new relationship with Busitema University. And so my presentation today is not really, I'm not trying to sell NSSF products. Everything I'm talking about is really in relation to innovation. But for those who may have questions regarding other NSSF activities and products, you can still reach out and I can connect you to the right people to answer some of those questions. But to be specific, today I'm just giving you a high-level overview of our involvement, or should I say our activities in relation to innovation. So at NSF we always make 10-year. Our strategies always last we target for 10 years. It used to be 3, then to 5, then to 10. We realized the long-term goals seem to give us better value. So this is what I'm basing my presentation today on. So, our purpose and vision remain enduring, guiding everything we do as we chart the path to Vision 2035. So our current strategy that we are following is targeting our goals. We intend to achieve our goals in 2035. So we are still in the very early stages, and engagements like these are what help us achieve this strategy. So let me take you faster. At a high level, these are our goals. We intend, currently there are about 50 million people in the country, about 3.2 million members of NSF, and of the 3.2 million, only about 800,000 are actually actively saving. So you see, out of, if the country has about 50 million, we have a long way to go if we are to reach the 50% coverage. And when I say the entire population, yes, we intend to provide social security for everyone, not just the working people, but even the children, the entire informal sector, And we are trying to devise ways, and through engagements like these, through innovations and ideas that we receive as we have these kinds of engagements, we are sure we're going to achieve that goal. And also we intend to grow our asset size to 50 trillion. I'm sure most of these are not new for some of those, for example, who attended our annual members meeting. Satisfaction rate for our members, 95%. And the only way we are going to get there, really, at a very high level, from the innovation perspective, again, we are looking at convenience, because we can innovate in that area. How can we make our services more convenient? How can we reach our members better? Also, empowerment. And specifically, what I was driving to is products that help members meet their social security goals. Because for a while, social security has just been about retirement or invalidity, and a majority of us, I'm sure, know that social security now, if you've traveled to some of the countries which have more advanced programs, social security is beyond just giving you retirement savings. It's you need health care when you're still, there's education, there's housing. All these are necessary before you actually reach retirement age. And we have realized that this is a must on our side. We have to create this value for members. But given that, of course, NSF, we are mandated by the law, there's a bit of restriction on what we can do or what we are allowed to do by our bosses upstairs. So we've found ways to work around that. So we've found ways to strategic partnerships with various entities, funders, incubators. This is how we've found ways of creating value for our members without breaking the law, while still sticking to the government's stipulations. So we are anchoring our strategic focus, again, through innovation. As I said today, I'm just mainly focusing on innovation, but our strategic focus, there are other pillars, but I'm just focusing on the ones that are to do with innovation. So we want to create capacity to save, and we want to create the willingness to save. We don't want people to save when they're under duress. We need them to save with the right attitude when they actually want to. And they also need to be able to save. And the only way we can do this, again, is through various innovative endeavors. So the outcome, again, is we want to avail Social Security to more Ugandans. That's aligning with the 50% coverage I talked of earlier. Maximizing earnings for our members, already our members, the annual interest we announced, we want our members' savings to grow even further. And also maximizing the value for our members, and the value, the examples I was giving you of people have housing issues, people have health issues, people have education issues that they suffer way before they reach retirement age or before they qualify even for midterm access. So that is what we are focusing on. And so I'm going to take you just slightly, a bit very quickly, in some of the activities we've been doing. Our approach is this. We can't just tell, and that's what the slide is talking about. We can't just be asking people to save every time when you don't even know where they're earning, how much they're earning, or if they're earning. Asking them to save. You don't know if they were able to pay school fees for their kids, but you're asking them to save. So it's a kind of oxymoron to keep asking people to save, but you have no idea whether they're even able to save. So our approach is we empower the members to save, then they can save. So we've been doing a couple of activities, empowering various communities. Some of these are not very public projects, but the whole idea behind it is we want to empower. If you're able to save and we ask you to save, then we'll be aligned. How do we empower some of these communities? Again, through various innovative endeavors. We've come up with various business and operational models that we use with different communities, which help us empower those members to be able to serve. Some of them it's capacity building, some of them it's training, some of them we provide them with tools for business, some of them it's just linking them to markets or getting them access to certain platforms, and we measure this impact over the years, and it's actually working. And I believe, again, engagements like these is how we can build this value even further together. So I'm going to take you through these three areas. These are not the only areas that we are really working on, but these are the areas that I can freely share currently. Some of the other pots are still being cooked, and it wouldn't be good to display food that is half cooked. So with agriculture, because that's the backbone of Uganda basically, although the border industry seems to be competing with it, those numbers are really, really growing, and they have a lot of youth, but we are also already there. That's another example. The border union, actually, I think we signed the MOU with the borders and the taxis and what recently, I think this week. Still in the SEMA, we are trying to reach them and get all of them. So we have onboarded about 5,000 border riders. Each of them have at least over 10,000 shillings saved. And it's through such engagements that we're able to even get to talk to the border union. And as the time goes on, you'll see in the news the value that will come out of that. But agriculture is is definitely the backbone of the country. And what we are trying to do is bringing value to the whole value chain. There's a repetition there, but so we have various projects that we work with when it comes to agriculture. And an upcoming one, of course, which actually we intend to really work with the university on, is the NAMCO one. Basically, the aim is to improve farmers' livelihoods by granting them access to markets with advantageous pricing, thereby empowering them and facilitating savings for 8 million households with the NSSF. So we're talking about 8 million farming households. That's how big the number is. So there's an upcoming project that we are actually going to we hope to work well with the university here, mainly, but the goal is to empower these farmers. And some of these farmers already have land, they just really need help and access to various capabilities at a high level. Again, I'm trying to save your time. That is on the agricultural part, but if you want more detail, please feel free to reach out. There are websites, there's content I can always share for more detailed information on this. It's not private information, so most of it is actually public. High Innovator, I don't know if any of you have heard of the High Innovator program. This is in partnership with MasterCard Foundation, and the goal here is really, it's business development and business support. We've run several cohorts, and what we do is we find SMEs, entrepreneurs who have interesting concepts they want to deal with us, and they come, they apply, we connect them to our incubation partners, they get the training that they need and the facilitation. Commercial break. So with the High Innovator program, we've been funding businesses. We've actually funded quite a good number of businesses. If you've seen the news, I'm sure you've seen some of the details. And the goal here is really to help SMEs and the micro SMEs. We train them, again, we connect them to markets, and eventually the goal is to grow them to, we no longer want micro SMEs. We're okay with SMEs, but micro, we want the micros to become at least SMEs. We want to grow them to SMEs. That's one of the goals. We have There's a whole other paper on the classification of the small and medium enterprises in Uganda that we are following. But in this area, this is another area we are welcoming, because I've seen a lot of presenters throughout this entire symposium. And again, I would encourage most of the presenters, because I've seen some very compelling concepts, and I'm aware that many people don't know that we actually receive business ideas and we evaluate them, and if we are aligned, we find a way to finance and actually grow it and make something of it. Now, there are many channels. You can actually walk into the office at any time and ask for strategy office, for example. And we can always have these discussions. We are very open to these discussions. And that's how the likes of the Border Union, that's how we started working with them. They just walked into the office, actually, and we started talking. And a few months later, we are signing MOUs. There are other several partnerships that we have, of course, that I may not have off-head, but insurance companies, hospitals, banks, and some of other entities that some people would consider competitors, but we actually collaborate. So when it comes to the innovation space, we are really encouraging anyone that has something that is compelling or something they believe in to come and engage with us, because again, we are trying to create new value. And one thing we have learned in this industry and globally, and the way the entire environment or business environment is changing, if you don't innovate, you get irrelevant very quickly. There are very few services that we are offering now that are not being offered by, 10 other firms. So if we don't do this, that's why we put a lot of effort in the innovation, because if we don't find new ways of creating value, it's just a matter of time before we are irrelevant. For example, we are blessed, or should I say NSF is blessed, that people are supposed to contribute. It's part of the law, but we always play a scenario where if the government woke up one day and said it's no longer mandatory, people can save with NSF only if they feel like. The question we're always asking is, how long will NSSF survive? And that is at the back of our minds, and it drives most of the activities we are doing now, because we do not want to be relevant because the government said you must save. We want to be relevant because people actually want to save with us. So that's one of the main goals of our innovation program. Our innovation program actually is quite big. It's a team of about 17 people now, and it's compounding. Yeah, it's almost about 30 people, because we have other stakeholders we deal with on contractual basis, still on the same still on innovation. So with High Innovator, I don't want to go so deep in that, but the information is also available online. I can share the links, whoever is interested. But if you just Google High Innovator NSSF, you'll see a lot of links with most of the information there. There's training, there's you can see the directions on how you can be part of the program. So let me move on from that. Smart Life. Smart Life is another way that we are trying to also get into the formal sector, and another way we are trying, because it's also a result of the internal innovations, we are trying to see, we are trying to break away from the usual, you can only get your money when you've turned 55, or when you're about to die, you're sick of HIV or something, or you've joined police or the army. So we are trying to go away from that. So with Smart Life, really, we have made it flexible for members. And the whole idea here is with Smart Life, you can contribute as any amount you want whenever you want. And you can choose how long you want the money to be locked in. But your money will still be gaining interest every day. And I'm sure majority of us, I've met some members here actually who are already Smart Life members. But besides that, the innovation team again is working tirelessly to add value Soon we're going to have a housing product attached again to Smart Life. There will be health products, there will be products related to education as well. So I'm not selling, but it would be really advantageous if you're a member of Smart Life way before some of these amenities or some of these capabilities roll out. But again, Smart Life also is an example of, it's proof that innovation is existing within the fund, because that's a direct result of it. As well as High Innovator Program as well. It's also a result of still the innovation endeavors within the fund. All these have been products of the internal innovation program of the fund. So when they grow big, we break them off into separate. So High Innovator now is separate from internal innovation because it's too big to sit with internal innovation. Same thing with Smart Life. Started as an innovation, but now the stage it's at, it's sustaining itself. So at a very high level, what we do, for example, if you came with a concept, we have a process that we follow for managing most of the innovations. We always have several concepts in our portfolio at any given time. So we carefully track these on a quarterly basis and have to be pumping out at least one new concept by the end of every financial year. Those are some of the targets. Now, what does that mean? I know some people are always skeptical about their concepts, bringing their concepts in. Some are not sure. And I would encourage them to just bring it in and see what happens. Let's discuss. And there is no worry on, how do you call it, patents. Our legal team always and our policy always have you protected if you come with your concept, because the majority of the people tend to not go the legal way before they come, so we kind of guide them in that area. But the other thing is with innovation, I'm sure if there are a couple of innovators here, when we're doing it at scale, we don't expect 100% success. That is completely impossible. In fact, the reality is out of the 10 concepts you experiment on, 1 or 2 become big. In a year, we have about, I think last year we had at least about 15 failed concepts. But this is where the innovation program comes in, because we have methodologies we used to drive or we used to experiment that help us, for example, minimize risk, help us minimize costs. If there are any innovation experts in here, if you know some of the processes, prototyping. When you reach the stage of prototyping, some of the particular characteristics that you have to put into consideration. Why I'm telling you this is so that when I tell you that 10 out of the 12 concepts failed, someone might say, oh, that is a lot of money wasted, a lot of members' money that has been wasted. That is not the case, and that's why we have the program and the processes, and we are constantly investing in the expertise to make sure that it's as efficient as possible. So I would go ahead to give you more detail about Smart Life, but there is more detail online than there is in my presentation. And I will direct you there online because fortunately or unfortunately I have to travel back today, and we're not allowed to travel when it's dark. But at a high level, the take home is really we are really looking into diving deeper and engaging with individuals as yourselves, researchers, academicians, experts in various fields. Because at the end of it all, if I'm being honest, at NSF, majority of us are accountants and people who are, the bias is really financial. So when we are working with, Dan, so when we get to engage with people like you, you bring a certain aspect or side that we may not get internally. Now, when we merge that with our finance experts, and that's how we turn an idea or a concept into a viable business that we can scale. And I believe that's how we'll empower our members so that we can get more savings and have more people socially secure. Thank you very much. In case you have any questions, please feel free. Thank you. Thank you.
Thank you very much. Our sponsor from NSSF. Anyone who has one burning question? You are 42 years, you want to get what? Professor Gava Mukuya. No, you still have a longer way.
Thank you for the presentation. I just wanted some clarification, not from what you presented, but sometime back we told that the housing finance is owned 51% by NSSF. How true is that, and how do members actually benefit? Thank you.
I appreciate the 1 minute because my detail is limited on that. But yes, we have board representation, and yes, we own a good portion of that. And the way the member benefits, the member may not see it directly, but remember, whatever profits or dividends we get from our investment in housing finance, definitely plug into the interest that we announce every year. So again, housing finance is a very lucrative partner for us, and we actually send some initiatives there that we can't run ourselves. For example, some of the housing, there are some housing concepts that have come to NSSF that we have advised to go and work with housing finance, simply because the law doesn't allow us to work with them that way, but the bank is able to work with them that way. So again, you see, we get the value of that partner, not directly with us, but through housing finance. Some examples I can give, there's this company that does prefabricated housing. Is it Easy Housing? Yeah, but our due diligence did not allow us to really easily work with them. We tried, but they are currently working with housing finance. So eventually they did what they needed to do with us, but through housing finance. That way we stay protected from breaking any laws, so to say. That's fine? Thank you, thank you.
Let's give him another round of applause. We are now coming into the official closing ceremony for this important symposium, and it's my singular honor and pleasure to invite the Dean, Faculty of Health Science, to talk to you.
We might forget to appreciate the chair. Let's give him a hand of applause. Ladies and gentlemen that have attended this conference for the past 3 days, allow me to appreciate you in your respective capacities. Appreciate yourself, appreciate your neighbor with a hand clap. I don't know how you describe this conference with one word. For me, I say it's amazing, excellent. I don't know what word would use to describe this symposium in one word. But allow me to appreciate you. I know in your different capacities, we have leaders of various institutions, our sponsors. It's very impossible to pull a successful event as one person. It's a very common saying from Nelson Mandela that if you want to go deep and far, you have to move as a group. And this is exactly that has brought the winning strategy in this particular conference. It's impossible that Busitema could run such a conference without participation from our sister universities, without our sponsors, without our management, without the deans from the different faculties. We really appreciate the contribution. There are many people to appreciate. Our students, you've been so marvelous, and we really, really thank you. What I know, good things really come to an end. If there's something that is persisting in your life, it is bad. Good things come to an end. And we are getting to the close of this ceremony. And I would like to really appreciate our organizers. Let's extend a hand of appreciation to our organizers. I've also taken a number of lessons, is that when you want to do something as a dean, you have to, or as a person, you have to choose the right team, and perhaps you might not move with everyone to do that. Let's extend another hand of appreciation to our team. It's a team of few diligent people led by Dr. Samuel Obakiro. Perhaps they'll have a platform to be appreciated to do that. I've also taken a lesson from the different presentations that have been given, that I am an industry. I am an industry. Please tell your neighbor you are an industry. We have seen an industry of fiber started by one person. I saw an industry of contraception. I don't know what other industry you can make or you can generate in order to contribute to our national cause or socio-economic status. That's the question. I'm going to go back home or to my office thinking that I'm an industry. I can generate an idea. I have knowledge indeed. I have my area of specialization. And I need to turn that knowledge into practice, either making honey or something a little bit different. Look at the propolis, and there are many industries that I'm seeing here. So as you go back to your different homes or institutions, keep at the back of your mind, there's something you can begin in order to contribute to our national development. The chair of our symposium is an industry of Tazkov. It's an example. There are many people here that have started. We saw Red Cross starting an industry of blended first aid. It's just within your abilities in order to improve that. The next lesson I have taken, and perhaps you have, is that it's nature for human being to look for value. We tend to look for value. And perhaps throughout the talks and the various speeches, it has been value addition, value addition, a value addition. Once I'm dressed in a suit or a jacket like this, I'm definitely of better value than someone wearing slippers or something like that. So as we get back to our institutions, what would be on our hearts is to add value to our teaching and learning, and that will definitely require steps of innovation, which has been a center, would have presented anything in this conference, but we are very intentional to talk about innovation. As you look around this building or wherever you'll go, it's value, a new iPhone or whatever, and that's what you're looking for, something of value. You always commit. To pay or an extra cost to that. So, how do you achieve this value? The people who have innovated, you have seen a few innovations. Again, I'll quote Nelson Mandela. He says, it always seems to be impossible until it is what? Until it is done. This conference looked extremely impossible in my mind, or in the minds of the organizers, until it's finished. Has it been successful? Yes, let's extend another hand clap. Another promoter says, just do it. Just do it. So as you get back to your institutions, just do it. Just organize a conference. Just begin a movement of an industry. Put your minds together, and it will happen. As I conclude my speech, we always have to recognize people, to honor them for what they have done. All presentations were excellent in my eyes. They were extremely excellent. If it's just finances that would limit us to recognize all of you. But I believe in one way or another, you have been recognized. And it's always important as you get back to your institutions to recognize whether it's a paper in form of a certificate of those people who have stood out in order to motivate and in order to pull people into a new direction. Once again, thank you so much. Send our greetings from Busitema University, from our Vice Chancellor in his absentia. And we look forward to collaborating with each one of you. You might have not seen me seated here 24/7. I usually take opportunities in such conferences to cut deals. I've cut a number of deals. I hope you're not going back empty-handed. I already have a few grants in my pockets through this conference. Please use the last minutes to whisper to someone that will enable you to break through. Thank you so much, and may the Lord bless you.
Thank you very much. Another round of applause to our dean. For us at the Faculty of Science, he's not a dean, he's a friend, he's everything. You can ask Ms. Kawara in it to tell you the more stories. May I request our keynote speaker to join the dean for a photo? We missed it and we can't afford to miss it. He will be joined by the director, the dean, Faculty of Engineering. The photo is going to be taken from there. The dean from Bishop Stewart, if she's still around. She's balancing the gender. Also, Professor Kaye, please, we request you to be in this photo. Where is the camera? Cameraman, first put them because it's going to be on our billboard. I want to invite the Dean of Natural Sciences. I want to invite Associate Professor Matov to be in this photo. I've seen him around, unless he has excused himself. Make sure it comes out. Take your time. Director. Thank you. The two who are seated can remain. The rest can take their seats. May I invite students who are in this room to come and take a photo with our, yes. Students, if you know your students, take this chance. The first 5 students, then the rest, we shall take 2 sessions. The first 5. Bostis 2025. Thank you. The next group of 5. Don't come. You have first overthoughts. You may. The last group. Please join. Thank you very much for that. We can now, I request the director. You can hand over to the keynote speaker. Thank you very much. At this time, I will request that the director, yes, no, it's your time to speak.
Good evening, everyone. Yeah, I'm not going to give a speech. I'm just going to thank all of you for being here. I know we have had PowerPoint warriors, we have had dreamers, we have had innovators, we have had scientists, we have had business people. But the most important thing that has come out is that even when you were seated there and you don't understand the graphs and they look like art, you were still patient enough to sit and listen to the talk. So we thank all of you who have labored to stay here for 3 days. You have made a mark for us as Busitema University. And we believe that this is going to be a collaboration that is going to last for ages. Why am I saying this today? Please do not go back if, like my dean, I understand now is the super dean because he heads 2 campuses. Like the super dean has said, do not go back when you have not cut any deals. If you have not met anyone, please ensure that you meet the people. If you have not spoken to anyone you don't know, please speak to them because those are the collaborations you're going to count on. Those are the collaborations that are going to bring in funds. I'd like to, in a special way, to still thank all of you who really took time to send in your abstracts and also to travel long distances. We don't take this for granted. We believe that this is going to be a collaboration that is going to last for ages. And I'd like to also to encourage you, please give us the feedback. Scan that code and give us the feedback. Visit that Google page and give us the feedback because we are working together to build this country. As you well know, the government is working towards achieving the 2040 goals, and we are looking at becoming a middle-income country. We can't become that if we are not doing innovation. And as we know, you are the catapult, you are the impetus, you are the rocket, you are the fuel for this country to ensure that we achieve all our goals. I would like also to say that as you've been here, and as we head back to our universities, to our labs, to our research groups, to all our projects which we are involved in, one thing that should come out is that you have had impact here. But just like Isaac Newton said, you know, we have to stand on the shoulders of the giants. And in order to stand on the shoulders of the giants, as we have been here, we have been lifting each other up. And we have been lifting each other up to have a common cause. And so if you have an idea, please share it with a friend you've met here. If you have an idea, form those collaborations. If you're writing the proposals, call that friend of yours you met here. and always ask for advice. And we have, from the time we started here, we have met a lot of impelling discussions. And we believe these discussions can come out, like the Super Dean has said, to ensure that we build industries. We as academic staff, in most cases, we have focused so much on publications. But now it's time for us to ensure that we build industries. And in order to do that is either when we are working together as a group. You need somebody from the management. You need somebody from health science. You need somebody from engineering. You need somebody from agriculture. As I conclude, there is always something. I remember I was telling the Faculty of Health Sciences, because I'm from the engineering side. And I was like, one time the Faculty of Health Sciences came and told us in the Faculty of Engineering that, you know, we are having challenges because what do you call when the prematures are born? That kind of thing you do. It's called what? Kangaroo? The medical people. The prematures. Kangaroo what? Yes. Now, they were telling us, can we develop a material or a sac that those babies can be put in, and then you can monitor everything, and maybe the doctor can monitor everything on the phone. But to date still, and despite the fact I'm a materials engineer, we have never come up with the innovation yet. Yet it's still there lingering around. So if we join hands, we are able to come up with a lot of innovations. And last but not least, like I've already said, I remember I had a challenge with my organization, the oversight organization, which controls engineers, the Uganda Institution of Professional Engineers. And I was like, why do we spend 4 years in class? Why do we spend 4 years seated in class pumping engineers, and then all of a sudden we say that they are engineers? Why don't they study 3 years and then spend 1 year in the industry? They refused, but I'm still on that. But what am I trying to say is that we can only get problems to solve if we go out to the society. We are not going to get problems to solve in classes. That's why the doctors publish a lot, because they are out there in the hospitals, in the society. They have a lot of data. For the other fields, it's time for us to go out and look at the problems that the country is facing, and then we'll be able to solve them. As Busitema University Science, Technology and Innovation Symposium, I would like to say thank you very much, and let's meet again next year. And I'm sure next year is going to be big, better, and super marvelous. And I hope to see all of you. I know the students would have graduated, but please come back still. God bless you. And thank you in a special way to the organizing team. And you know, they formed this thing out of chaos. The chair knows. They formed this thing out of chaos, and they have made it one of the most successful conferences that we've ever had. Thank you very much, Chair, and your team. God bless you.
Thank you very much, the director. When I grow up, I want to speak like you. I don't know whether I can. So, at this point, we are about to end. I want to confirm as the chairperson organizing committee that you have got your certificate if you're a presenter. And on that note, therefore, to confirm that people have got their certificates, we are going to recognize them in groups. So you come with your certificate, a group, not a person, and we take a group photo. I will start with the team from King Caesar University. I will go next to Bishop Stewart. When I say you come, the photo booth is here with your certificate. Yes. Then we shall go to, yes, here. Let's be fast a bit. King Caesar University, Bishop Stewart University, Kabale University. We can go to Kenya. If you're a delegate from Kenya, please come over. Very good. Delegates from Kenya all come at once. Yeah, all delegates from Kenya come at once. You take and you say, no, take this and you go. Very good. So she's representing the Kenyan team. Thank you very much. I've assumed that Bishop Stewart people have left. So Kenya, I'll go to Red Cross. Is Red Cross still available? Red Cross. Islamic University in Uganda. Islamic University in Uganda will be followed by Faculty of Agriculture, Arapai campus, Busitema University. Faculty of Agriculture, Red Cross. You can take him a photo. Yes. This is a very serious issue, yes. Take him, it's okay. Thank you. Islamic University in Uganda. Faculty of Agriculture and Animal Resources will be followed by Faculty of Health Sciences in 3 categories. Faculty of Health Sciences, students, upper, not lower. Then we shall have Faculty of Health Science, student lower. That is year 3 and below, lower. Year 3 and above and even postgraduate. Then staff. Can I see the lower coming? Faculty of Science lower. Please, let's come very fast. Please come with your certificate. Marion, you are the leader. You are representing. Then we have upper, MICRI, IDEA Fellowship students. I thought there are very many. So since you are few, let's come together with those people. Let's have IDEA Fellowship. If you are here, you come and join. We are few. I thought we are very many. As the staff from Faculty of Science also prepare to come, Kenneth, Brian, Joshua. All right, Kenneth, Brian, Joshua, come and represent the Faculty of Health Science. The dean wants to take a photo with you. And other staff, Prof. Gavamukura, you can come and help us all of this. For our magazine, for our very many things. Even other staff are present. Faculty of Engineering, led by the director. Prepare, you are the one following. The dean is present. Hey, Professor Rose, yes? Professor Matov, please, kindly, we request you to join this photo. Please. Faculty of Engineering, the director is leading the team and the dean. Bagole Chris, I'm seeing you. Want to say Bagala Ivan? I'm seeing you. Faculty of Natural Resources, are they present? Yes, I saw the director, Maritime. Has he left? Oh, sorry. It's okay. Our visitors, if I've not mentioned your institution, our visitors or any other institution, Faculty of Science and Education, Dr. Hokel. Yes, you mean Dr. Nima is here. Faculty of Science and Education, Annette. I'm not seeing you, Annette, Andima, Dr. Okero. Please come. Yes, Dr. Mbabazi, yes. Emojong, you are going to represent Parisa. No worries. Come over. It's okay. Boston. Yes, one man is faculty. Please come and represent. Faculty of Management Science. Let's clap for Emojong Ronald. He has been very, very active. You tell them next time I join you, but you extend the other side. All right. Again, I don't want to miss anybody. Maritime? Yes? Oh, Mbarara University. Thank you. Mbarara University. Any other I've forgotten? Natural. Yes. Yes. Thank you. Thank you very much for that session. As we come to the close of this session, we promise that we shall give a communique for what has transpired, but in the interest of time, I will not read it. It's a bit long, and it has been prepared by none other than Mr. Emojong Ronald. Let's clap for him. It's very comprehensive. We shall share it in the appropriate. But some of the most important things that he has observed and all the rapporteurs, number one is that from this conference, there is a need to strengthen university, industry, and community collaboration, and is calling it a tripartite. Many times we talk about university, industry. He's noting that we need to add on a community component, such that we have university, industry, and community. He also noted that there was a lot of talk about promoting capacity in mathematical and computational modeling in different scientific fields. We have had a number of presentations in those areas. Then integrate digital literacy, systems thinking, and sustainability in higher education. Enhance research and development in green manufacturing and bio-based materials. And then strengthen community health education and early warning systems in climate vulnerable areas. These are some of the things and many others that are coming out as top discussions in this conference. There is this one of building industrial value chains around priority commodities. The case in example I've discussed is banana. I think this conference on the first day was full of banana. So on that note, allow me to go to the last segment for this, where we are going to award. All of us have excelled. Our dean says all of us have excelled. But even among those who have excelled, there are those who have excelled more than the others. So at this time, allow me to invite all members of the organizing committee in front. All members of the organizing committee in front. Dr. Lima, you are near me. So, in the Faculty of Health Science, as you've heard, this organizing committee was not only Faculty of Health Science, it is a mixture. And there's nothing my dean can do to say thank you to you guys. Let's clap for ourselves first. You have done very well. Our director, please. You are our head.
The organizing committee is also going to award certificates of appreciation, and I'm just going to read the names here. And the certificate says, certificate of appreciation presented to, your name will be read for having served as a member of organizing committee. And I think I can stand over here. Dr. Peter Opio. He has been the deputy, and hopefully next year will be in your in your faculty. This one is aside. Associate Professor Safina Bira, this is the DVC. I think it will be taken. Associate Professor Gilbert Ochen, I think the Dean can come for this so that we'll be able to deliver it there. Professor Chibule Jan. Thank you. Associate Professor Yahya Gavamuklia. Well done. Dr. Adam Smith. Associate Professor Musawa Milton. Still the Dean can take it to Associate Professor Rose Nabile Shalom. Miss Kagoya Kawala Init. And I think you can see she's well dressed. She's protecting the gains of the conference. Associate Professor Joseph Kebi Matovu. Yes. Professor, you're welcome and well done. Yes. Thank you. Mr. Christopher Bagole, the one who has been in charge of innovations. Dr. Moses Sandima. Yes, the IT. Mr. Brown. Very active. Dr. Charles Muesi. Peace. Peace, please come for it, come for it. Well done. Institutional Advancement, your directorate. Dr. Joseph Hokelo. Well done. Dr. Annette Chomhang. Well done. Mama Math. Mr. Sevagalaivan. Well done. Miss Oyese Nafula. Well done, the secretariat over there. Thank you. Associate Professor Nibiko Eldofons will be delivered. Engineer Dr. Wanyaga Joseph Dumba. The man. Well done. Mr. Ndamanya Kalisid. Yeah. Mr. Mane. Well done. Dr. Opio Peter, there are two. Wow. Is he a twin? You're a twin. Wow, you have another one here. And last but not least, the man, the perfectionist, Mr. Perfect. Dr. Obakiro Samuel Becker. Thank you very much.
Yes, our next group of awards are going to, I'm going to invite the Dean Faculty of Engineering to read the following people for the work well done for this conference. And Professor Dan will award the certificates.
Certificate of appreciation presented to Associate Professor Rosemary Chalo. For having served as a session chair. Appreciating another session chair, Associate Professor Joseph Mato. As Dr. Joseph Okelo prepares. Dr. Iramoit Jacob, get close. Jacob, okay. Dr. Opio Peter, get close. Associate Professor Yahya Gavam Clear, get close. All these are appreciated for chairing sessions. Dr. Rebecca Nekaka, get close. Dr. Pio. Dr. Masaba Sowed. Dr. Rebecca Nekaka, since she left. Rapporteurs now, appreciating rapporteurs. Maureen Chepkasis Kiplel, sorry, I hope I pronounce it well. You will forgive me. Next is Mr. Ivan Sevaga, please get close as Mr. Kehe Ronald also moves. Then Mr. Eputai Joshua, please also get close. Wilberforce. Mr. Wilberforce, the other name I'll pronounce it tomorrow. Dr. Ronald Chivuka, get close. Dr. Brian Senkumba, please get close. Dr. Kennedy Chimba, get close. Dr. Brian Senkumba again. Mr. Ronald Emojong, get close.
Journaling is a brilliant way to tackle the blank page. Activate our creativity.
And second last, the session chair goes to Engineer Dr. Dumba Rwanyag. Allow me to communicate that when the members sat, the position for the best session chair has gone to Associate Professor Joseph K. Bimatov. I right now invite the Dean can take a seat. Where's the Dean Fakatov Namatagad, brother? Natural Resources. Yes. Yes. So we are going to the most tense part of the ceremony. We have received various scores. We want to award the best performers. All of us have excelled. And it was very tough, and allow me to inform you that we had 6 themes, and some of the themes, unfortunately, did not have presentations made, despite the fact that we received some abstracts from them. So there has been a very stiff competition in some themes. I hope all of you can guess what happens in one here, where the stiff competition was too stiff. But even when it was stiff, the committee had to choose who are the best. So I would like to request that we start with the first runners up. We are going to award the 2 categories. I've been advised by my friend here that let them first scan that code before you read. You can scan from a distance. Tell us if you have a smartphone and scan. We are giving it 2 minutes to scan the code. So, one of the things we want to recognize are the young scientists who have excelled in this conference. Let's clap for them. Some of us presented the first time when we are doing our PhDs and so on. So if you have a student who is in 2nd year, 3rd year, and is presenting, I think that is the spirit of promoting research Busitema University is taking. I believe they will be happy tonight for having been awarded. So the first award goes to Agenorot Sharon Dory.
Thank you. This certificate is being awarded to one of the young scientists, Ageno Roth Sharon Dory. Yeah, congratulations. Thank you, thank you. The next award goes to somebody in the field of industry
technologies and clean energy. Oh, okay. Yes, this is, sorry for the mishap. The next young scientist being awarded is in the field of climate smart agriculture, and that is Abo Sylvia. Congratulations. The next award goes to the young scientist in the field of transformative education, and that is Shibuka Ronald. Congratulations, Ronald. The next young scientist being awarded is in the field of One Health, and that is Nabat Maria Marion. Congratulations, Marion. The next award goes to the young scientist in the field of entrepreneurship and enterprise development, and that is Wamono Bruno Noah. Congratulations.
So as they are taking those photos, we have two fields that did not front any young scientists. And this is a challenge to those areas, people who are here. And that is the field of industrial technologies and clean energy. There was no any young scientist. And then the field of science, technology, engineering, and mathematics. There was no young scientist. So the committee decided that since there were no young scientists, but there are those fields which are overrepresented, let's give this certificate to the people in those areas which were represented. So two fields were overrepresented, that's agriculture and One Health. And so the committee decided that the following students should be rewarded because of the excellent presentation. So one was number 2 to Marion, another one was number 3. And I have the honor to allow the dean to read them.
Thank you. The young scientist being awarded in the field of industry, technologies, and clean energy is Kweheo Ronald. Congratulations, Ronald. The next award goes to the young scientists in the field of science, technology, engineering, and mathematics, and that is Ariokot Mary Agatha. Somebody will receive on her behalf. Congratulations.
Thank you very much. Let's clap for the Dean, Faculty of Natural Resources and Environment from Namasagari campus. We have our brothers from IUI University. I want to invite one of them, unfortunately I don't know the name, to be the one to give the certificates to the first runners up. One of the two, the Nigerian guy, I love the way he was presenting about systems thinking. So let's invite one of our colleagues from IUIU.
Yes, on behalf of the organizing committee, I'm honored to present this award to the first runner-up paper presentation award in science, engineering, in science, technology, engineering, and mathematics. And this goes to, please pardon me for the pronunciation of the name, Kinyemba Kennedy. In the same line, first runner-up paper presentation award in entrepreneurship and enterprises development. And this award also goes to Kennedy Intabo Otiso. I think all of us should start changing our names to Kennedy now. Thank you, congratulations. Also, first runner-up paper presentation award goes to in the area of transformative education, and this ever goes to Joshua Eputai. Also, first runners-up paper presentation award in One Health, and this award goes to William Okiro.
As it was the case in young scientists, it was the case when it came also to some fields, to even the senior people. So I would say that we did not have a presentation in plant health. We also did not have enough presentations in smart agriculture. So the committee said that it is going to scan again, but it recommended that since One Health had very many presentations, they award 3 people in that category. So the third person in One Health who was deemed to be awarded is...
This goes to Senkuba Brian.
Thank you very much. Let's clap for your name, sir.
Dr. Bolatito.
Dr. Oba. He doesn't know that my name is also starts Oba. All right. So thank you very much. Allow me to invite the Director, Graduate School and Research of King Caesar University, Professor Kaye, to award the best paper presenters for the 2025 Busitema University Science, Technology and Innovation. Let's clap for him as he's coming.
I'm very delighted to award the best paper presentation to climate smart agriculture to uproot immaculate. In that line, I'm also delighted to award the first runners-up paper presentation award in industry, technology, and clean energy to Ambrose Asabahewa. Shall be delivered to him. I'm also very delighted to award the Best Paper Presentation Award in One Health to Joseph Kasumba. Please give him a round of applause. Delighted to award the best paper presentation in transformative education to Wilbur Fitundinda. Hope I pronounced it well. This one I'm more delighted because he's very close to me. Congratulations. I'm delighted to award the best paper presentation in entrepreneurship and enterprise development to Rebecca Kalivwan. Rebecca, maybe she's not around. I'm delighted to award the best paper presentation in industry, technology, and clean energy to Bethel Taras. I don't know whether I pronounced it well. Bethel Taras or Tarus. She's not around.
I would like to award the best paper presentation in plant health to Aita Arnold. Thank you so much for coming to speak it on her behalf, on his behalf, sorry. First one, our congratulations to you. Thank you. And last but not least, the award, Best Paper Presentation Award in Science, Technology, Engineering, and Mathematics goes to Jacinta Mukonyo Mutwiwa.
As she's coming, she has been voted as the best presenter for this symposium.
So let me repeat. I would like to award, I've taken over the authority without permission, but let me say that I want to award the best paper presentation for this symposium to Jacinta Mukonyo Mutwiwa. Congratulations.
Thank you very much. I would therefore request that all those who have been awarded, from the young scientists to the first runners-up and to the best paper presenters, to come in front and they receive, what is it called? A gift from our Dean, Faculty of Health Science. Please come over and win yourself a gift. All of you who have been awarded, Emojong,
Ladies and gentlemen, I think we have indeed, this is a very end, very proper. And once again, let me extend thanks we have come to the very, very end. Thank you so much for your individual contributions, your participation. Let's not lose the bigger picture. The bigger picture is to lift our country into the middle income, or Africa at large. So receive thanks on behalf of our Vice Chancellor and the management of the university. We look forward to collaborating with you, working together. I believe in the next conference, this committee should not only be Busitema, we should also pick on the brains from other institutions such that we form a consortia in science, technology, and innovation. The last announcement, those who want a shirt, some of you are interested in many things. Some people are interested in shirts. A shirt will cost you 70,000 Ugandan shillings. That's around $10. Around $10. You'll contact our chairperson in case you're interested in shirts. In case you're interested in anything or you are not bold enough to express it, again, feel free to contact our chairperson through the contacts that have been shared, and we'll be able to respond. I wish you a safe journey and a successful career. May the Lord bless you, and bye-bye. I think we forgot to give a thunderous hand clap to our chairperson. Let's give him a thunderous hand clap.